Bwrdd, croeso. Good morning and welcome, everyone, to what is my first full public board meeting of DHCW. I'm very pleased to welcome all the board members, those people supporting the meeting today, and of course those people who are watching us remotely. As you're aware, we're still following Welsh Government guidance to meet as little as possible in person, so we will be conducting this meeting virtually and are likely to be doing so for the foreseeable future. We are using a different platform today. We've moved to Zoom, which has a number of advantages, one of which is that we can all see each other as a board and people supporting the board, which is lovely to see. It does make a big difference. Secondly, and really importantly, we are now able to provide simultaneous translation, which we will be doing today, and we've tested this to within an inch of its life, and it has been working really well. So we very much hope that will be the case today, and I'm sure it will be. As I mentioned, we are live streaming, so there will be members of the public watching in, and also, of course, the meeting is recorded and will be available on our website after the completion of the meeting. As has been mentioned at previous meetings, there will be on occasions where we're not looking directly at the camera because we've got papers on different screens and notes in front of us. So apologies for that. It's a necessity. There are a couple of comfort breaks scheduled during the meeting, where we'll take a 10-minute break. If people do, and it does happen from time to time, needs to leave the meeting for a brief period, then obviously please feel free to do that if you need to do that. But if you could turn off your camera and microphone whilst you're away from the meeting. I haven't been advised of anyone needing to do that, but circumstances do arise. Now, if we move into the, we're due to conclude by 1:30, and we will need to do that. And I suppose that's a big part of my job here today, to make sure that happens. If we're moving to the consent, are there any matters arising from previous minutes that I haven't had any raised with me? No. Okay. If we move into the consent section of the agenda, and again, I'm not aware of any questions being raised prior, and if they have been, they should have been dealt with by the relevant officer. Is there anything that anyone would like to move into the formal part of the agenda? If not, then I do apologize. There is one apology that came in late due to some illness, and that's Grace. Grace Quantock has given her apologies, and I've also missed out declarations of interest, which I have not had any indicated to me. Has anyone got any? Okay, so moving into the consent item, consent section of the agenda. As I say, nothing has been notified, so what I'm asking members present to do is to approve and note all the items as requested, and I'll go through each of these. The first is the minutes of the board meeting, which obviously I wasn't at, held on the 30th September. The second is the private board meeting minutes on the 30th September. The third is the extraordinary board meeting held on the 14th of October. Are people happy to note those? Thank you. And also we're noting the action log with all previous actions have now been updated and marked as complete or underway, including 3 actions from the previous board meeting held on the 30th September. People happy to note that? Yes. And finally, we're noting the contents of the forward work plan and item 2.5. Again, people happy to note that. Lovely. If I move on to the straight to the main agenda, and as is the usual practice, the first thing we have is a listening and learning presentation. And today that is, I'm going to invite Rydian, the medical director, to introduce it. But we're looking at the Welsh nursing care record work that DHCW has been doing. So I will hand over without any ado to you, Rydian.
Thank you, Chair, and good morning, members of the board and members of the public who've tuned in. The pathway to paperless healthcare is a pathway of small steps. They're often difficult and painful. Now, the Welsh Nursing Care Record is a digital programme that has shown great leaps towards this vision. The teamwork, user engagement, the use of information standards across this programme has been key, and the collaboration and nursing leadership has been second to none. I'd like to hand over to Fran and Judith to take you through this presentation, which is the third one of these types of presentations, and I expect you to find it as informative as the previous two we've had.
Thank you, Rydian. Okay, so first of all, I'd like to take this opportunity to say thank you for supporting nursing in this journey to a digital transform to digital ways of working. So I am Fran Bwrdd, I'm the National Clinical Informatics Lead for Nursing, and also presenting with me is Judith Bowen, who is the Chief Nursing Information Officer for Haldar University Health Board. So the aim of the session is to help the board understand what we've learned across the during our journey to the implementation of the Welsh Nursing Care Record and why we started that journey. So next slide. So where we were with nursing documentation across Wales, but also across the United Kingdom, that nursing was cited numerous times in various reports, such as the Andrews report, the Flynn report, and about how poor nursing documentation was. And alongside that, there was definitely each point in the patient care journey, patient-citizen care journey, the questioning of patients patients to nurses was onerous, and patients were unsure as to why their information wasn't moving throughout their healthcare journey. So there was a lot of duplication of questioning, but also a duplication of documenting. And alongside that, there was a lot of manual auditing reporting, which was very time consuming for nursing, but actually alongside that, it was only a select number of patients, whereas what digital obviously allows you to bring is that we are auditing patients, every single patient across Wales, to improve care. So next slide. So the vision for the Welsh Nursing Care Record, so we wanted to set out a vision at the very beginning so that we had a goal of what we wanted to achieve. So the idea of the Welsh Nursing Care Records is that nurses and midwives and the multi-professional team were able to utilise the data from the Welsh Nursing Care Record to drive improvements and support learning across organisations across Health and Care Wales to enable us to align our services to meet the needs of our patient population across Wales. But actually it was also aligning with what was set out in the Health and Care Wellbeing Act. Next slide. So the aim of the Welsh Nursing Care Record was to standardise and digitise nursing documentation across Wales, because we were at a point where in every health board to every ward, there was a real lack of standardization, and we're not talking the same patient language. And in addition to that, some of the key items that we had, as I mentioned, was repetitive questioning, and we were using different risk assessments across Wales. Following a public accounts committee, there was noted that nutritional deficits of patients were not being identified. So the aim was to support this and support a standardized language, but to improve the identification of risk of patients so that we can implement risk strategies to support our patients throughout Wales, and no longer keep them within secondary care, but actually reduce harm to our patients across Wales. And just one key statistic here that I've brought is nursing staff, if there were no sticky labels available for demographic information, they were having to place this on documentation or write this on documentation, which at some point in some health boards was 72 pages long. So just on an average, just by removing the need to write demographic information, there was a potential to save over 2,000 hours that will be able for nurses to put nurses back at the bedside to care for our patients. And obviously by reducing repetitive questioning, we improve satisfaction of our staff, improve satisfaction of our patient, and the idea was that we were putting the patient at the heart of the journey that we were embarking on. Next slide. So our main constraints and risks to our success was funding, and resources, and putting those together. The funding initially was non-recurrent funding and was funded via the efficiency through technology, but learning lessons from very well-known reports such as the Watcher report and the Topple report, there was very much a need for us to have both nursing and technical resources to support this journey. So in the very first instance, the only nursing informatics lead across Wales was myself. So actually the idea of the programme moving forward is how we could introduce those positions across Wales and realigning some of the funding to support that. Alongside that, we wanted to ensure that our user acceptance, this was a solution that was going to be used by nurses. So therefore it needed to be developed by nurses to ensure that it was fit for purpose and usable out there to support patient care rather than hinder them. And obviously, as nursing is the largest workforce across Wales, to enable that to happen, there needed to be a business change support, but it needed, taking 33,000 nurses off a ward to do 2 hours of training was not an option. So how could we support that model moving forward? So these were some of the constraints that we had to address throughout our journey. Next slide. So what were our key lessons? So, listening, and you can see here from this slide, these were just the people that were involved in this process. And it was about collaboration and using the areas of expertise that we needed to ensure that everybody was involved. And the idea, like I mentioned, is setting out that vision for the future and setting out key priorities was to ensure that we were all on the same journey together and understood what our end goal was and to support that journey. So, and aligned that we had a fit for purpose solution to support our nurses and our patients throughout Wales. And obviously there were lessons to be learned throughout the programme of work. And I would say moving forward, one of the key things was about having the resources to support the journey. It was about clinical engagement. There was extensive engagement by the programme, not only with clinical leaders, but also with our workforce and OD, organisational development colleagues, with finance directors, because it wasn't just enough to develop a system, it was about the implementation of the system and also how to optimise the system, ensure the data that we were getting out of the system was available to drive improvements and transform how we moved. Some of the other key lessons were that this is a clinical critical system, so we need to identify how our service management model is that supporting how we need to move forward. And actually we're a very adaptive programme, and we learn lessons across the way and share with other programmes, but also listen to what other programmes have told us. And one of the key items from that is how we need to collaborate together as national systems, because each system is required, is dependent on each other's system. So if a changes are being made within our patient administration systems, we need to communicate together with our Welsh Nursing Care Record team, because that affects how that is rolled out and utilised across Wales. Next slide. And over to Judith.
Thank you, Fran. Thank you, and thank you for the opportunity. Hopefully what I aim to do now is represent the outcomes from all areas from my colleagues across Wales. So what are our opportunities and the outcomes from those opportunities that Fran has just highlighted? Want to identify first the opportunity for user acceptance, and certainly as clinical and technical teams, that collaboration that Fran has described was a reality. We worked really closely with NWIS DCHW now to inform that the application was thoroughly tested prior to release and that it was guided by professional principles and standards. The biggest outcome, as you can see from the slide, is that we've got nurses at the bedside, enabling assessment, care planning, reporting, all via mobile digital devices. There are great examples across Wales where we've already got perhaps examples of patients moving between hospital sites for continuation of treatment, but we're able to share that record electronically prior to the patient actually being received by the team that they're moving to, so that that planning can start ahead of the patient arriving. Excellent examples I only saw yesterday with a ward round where GP and nurse were able to concurrently access WCP and WNCR on the same device, being able to look at radiology and results at the same time as the nursing care record. However, as Fran said, I think that one of the limitations is perhaps the current configuration of PAS at the moment, when we have patients, particularly in very busy times in areas that are technically not inpatient areas, but they still need to be treated as inpatients. However, standardization, going back to the opportunities, it's a massive opportunity to have a standardized record. It's supporting all staff in all areas to really document care in a standardized way and give consistency. The particular benefit there is the huge amount of agency nurses that we use in all areas, that it's a familiar record wherever they work, and the same applies for student nurses. Through their training, they'll be able to get very familiar with the application. All of this then brings huge patient safety benefits. Specialist teams, for instance, are able to access the record wherever they may be working and not necessarily have to be in the area of care. MDT members particularly are benefiting from it. And there's significant opportunities then for reducing the carbon footprint as a consequence of that. We've got examples of specialist teams who don't have to practically travel many miles, perhaps to see one patient. They can access the record from their base and be able to give advice to the care team at the point of delivery. Huge opportunities for cost savings. As Fran's introduced you and showed you the stack of paper that we currently previously used in care. Once we can start to whittle that down, there'll be extensive procurement savings with less paper being procured. And importantly, there's the workforce benefits. Nursing staff are incredibly proud. They're successfully using the application. They're seeing so many benefits. One that I'd like to call out is staff particularly who have a dyslexia. They're able to spell more easily. They can read the record. They can record much more efficiently, so saving them time. And it, all in all, produces for all staff a very clear, accountable and editable, auditable record. Next slide, please. So thinking about the user experience, as I say, I've highlighted quite a few, many of the benefits in my previous slide, but I think I particularly want to call out that partnership that Fran spoke about earlier. I have to say, as one of the early CNIOs who found herself in a very new role, in a very new world, we all struggled. And I have to say, the NWIS team, project team, DCHW as now, have been incredibly patient with some rookie informatics nurses who have now grown and growing into the role. It really is a collaborative. We're really fortunate to be able to work with an excellent team in DCHW and have the lead from Fran and Claire as the SRO. And it's exciting now, you know, the additional Welsh Government funding has meant that team has expanded. We've got Band 6 CNS informatics roles joining the team, and that will continue to grow. Along with that then has brought additional benefits for CPD with the evolution and the development of a MSc in informatics that many of the team are benefiting from, and the Florence Nightingale Digital Leadership scholarships. So as you can see, Welsh Nursing Care Record is live. We went live in April 2021 across, and we're now live across 5 organisations. I have to call out the incredible support that we've had from the DCHW Business Change team. Many of the live sites would not be where they are now was it not for that team. They're on site. In fact, we've got people on site today in a few of the organisations. They handhold, they guide, they support the teams, even those real technophobes, people who are going to retire. We don't do digital, we don't even have a phone, and often those people then turn out to be the biggest advocates for the system. So it really is, as an application, making a difference in practice. It's a very simple application to use. We've got a member of staff who was asked previously using Epic in Cambridge, and Fran, I'm sure won't mind me saying, asked her, if you were given a choice, would you use the application in Cambridge or would you use WNCR? And she immediately said no, WNCR. It's simple to use, it's applicable, and it's really helping my practice. So I could give you various other opportunities that are coming out from practice, but all in all, it's an incredibly useful system that's benefiting the whole multidisciplinary team in various ways, and importantly, safeguarding patient safety. Next slide, please. So to sum up then, as I say, it's proving very, very successful. It's exceeded all of the expectations and the early ambitions that we started out with in 2017. But it's a journey. We're learning every day. We share our learning within the team, within the project team nationally, and within other applications. The learning from Go Live sites is definitely used very effectively, and as I say, as Fran said, I think it's important that we share that learning with other applications so that we can benefit the ongoing development. And there is also a formal evaluation taking place via Bangor University, so that then will be captured formally and hopefully can be presented within a publication nationally. So thank you very much for listening. If I get on to the next slide, I'm sure Fran and I would be happy to take any questions. Thank you.
Thank you very much, Fran and Judith. And it does sound an absolutely incredibly successful piece of work, doing incredibly useful things and for both staff and of course patients. Now, I had 2 people with their hands up, Sian and then Marion.
Sorry, I'm going off mute. Just eisiau gwybod ydw I faint o y poblogaeth y nyrsys sydd yn defnyddio hwn nawr, a sut mae hwnna wedi creu amser nôl i'r gwasanaeth drwy bod lot mwy uniongyrchol yn gallu siarad gyda'r claf, ond hefyd ddim yn gorfod llenwi'r papurau enfawr na mas. Ond mae'n hynod y gyffrous i weld rhaglen fan hyn yn cyrraedd ac yn neud benefit dim ond i'r nyrs, bod i'r claf hefyd.
Who'd like to pick that one up? Is that Fran or Judith, or just chip in? Just whichever, whoever he wants to.
I don't mind. I'll answer. Absolutely. You know, they sit at the bedside with the patient and actually discuss care with the patient. So they have every opportunity. You can use it as an educational tool with the patient while you're sat there doing it. But the key thing here also is that although we've standardised the language for the Welsh Nursing Care Record, we've actually standardised the language across the whole of Wales, whether that be in community, children's nursing. So when we roll out other systems such as WCCIS, such as the new intensive care system, the mental health, all of that language is the same. So the idea is, in the future vision, is that that language, that patient data will follow the patient. So actually it changes the conversation that you have with the patient. No longer will you be saying, what medications are you taking? The questioning will be, are you still taking your medication? So actually you're almost triaging your patients right at the very beginning to plan their care that's appropriate. Because if, say, for instance, somebody's not taking a water tablet diuretic, as some people know it, and they've come in with edema, you know potentially why that is caused. So actually, yes, it's changing the conversation, but it will support and working with the patient program also on how, you know, as we evolve moving forward, how can patients input into that record also as well. So like we mentioned, it's the start of the journey, but absolutely, yes.
Thank you, Fran. Marion.
Diolch Cadeirydd, a gain eich llongyfarch yn gynnes iawn ar cyflwyniad y bore yma ac ar y prosiect hynod gyffrous yma. Mae unrhyw un sydd wedi treulio amser yn yr ysbyty yn cefnogi anwyliad yn gwybod yn dda gymaint o amser sydd yn cael ei dreulio ar gofnodi ac ail ofyn cwestiynau. Felly mae hwn yn ddatblygiad hynod gyffrous. O'n i'n hynod o falch hefyd o weld bod chi fel tîm wedi ennill wobr Brydeinig yn ddiweddar, yn wobrau diwydiant technoleg gwybodaeth Prydain, a dwi'n siŵr bod ni i gyd yn ymfalchio yn y llwyddiant ac yn eich llongyfarch yn gynnes iawn. Ond y cwestiwn sydd gennai falle ydy, wel, 2 gwestiwn yn gwirionedd. Da chi wedi sôn am y bydd, a mae hwnna yn amlwg o ran amser ag atgyfnerthu ansawdd y gofal mae nyrsys yn gallu roi i'r cleifion. Ydyn ni wedi gallu rhoi ffigwr o gwbl ar hwnna, ar y bydd yna, ffigwr ariannol, a byddai'n help falle i gryfhau'r ddadl dros ddatblygu systemau eraill. Felly hwnna ydy'r cwestiwn cyntaf, ac yn ail, a byddwn ni wedi gweld hwn yn cael ei weithredu ym mhob Bwrdd Iechyd yng Nghymru cyn diwedd y flwyddyn yn unol ar amserlen a bwriadwyd. Diolch yn fawr.
Thanks. And if I could just add a little bit to that question, because I think it was mentioned in the presentation, also quantifying the benefit in the terms of nursing hours and doing things, you know, by the bedside rather than, as you mentioned. I mean, that must be, again, it's going to be a next huge gain. As alongside any financial gain. Who wants to pick up on that question? And then I've got Helen. Go on then, Ridian.
I'll start, but mainly because the quantifying financial gains in a digital program is often complex, because people talk about cash releasing. The thing about digital programs is they require investment in other areas, particularly in devices, connectivity, and training, and therefore they're rarely cash releasing. This is about an improvement quality program, and fits with improving the experience of the patients, particularly on the grounds that we were just highlighting there, that there was validation of previously collected information at the bedside, therefore allowing the healthcare professionals at the bedside to start to explore what actually matters to the individual who's in that bed, rather than consuming time having to go over old ground, for example. The other element that is hard to financially quantify is the ability of healthcare professionals remotely to review the patient's digital record and therefore make clinical decisions that might prevent unnecessary journey, unnecessary tests. And again, it's very difficult to quantify how many of those are being avoided. I also think that a benefit which is difficult to measure, but very important, is the retention of staff in a new digital way of working. You will have heard the excitement and enthusiasm of individuals involved, and particularly that there are some online videos of people who've been at the end of their career. We're thinking that digitalization would force them to leave the career. They want to stay on. They want to see the next new element. So we talk about the paradox of digital programs is they rarely cost less money, but they definitely change the experience of both the user who's providing the care and the person who's receiving the care. So I just thought that would be helpful to set that scene.
Thanks, Rudy. And I've got Helen wants to come in and Rowan, and then there's another bit to Marion's question, which is the sort of timetable for rolling this out across all of Wales. So if at some point someone picks up on that, because I'm interested in that bit as well. Helen.
Yeah, I'll leave Fran to talk about the timetable. I'm sure she'll be able to give us the detail on that. I guess I just wanted to add my kind of thanks and appreciation, and just, you know, it's going to see this on the board, which I had the pleasure of doing last month. Honestly, I think, and I've been in the health service for 3 decades now, and I've been one of those business change people out on the wards. Actually, it's I can't tell you the joy that it filled me with to actually see nurses on the ward actually saying to us, this has changed the way that we're delivering care. This feels safer. I can see everything that is happening to our patients. It has saved me so much time. They all had smiles on their faces. Don't often get that when you go and visit kind of a digital implementation in practice. So and I think that's a credit to the application. You know, it is simple to use, a great kind of example of collaboration across national teams, national design and local development. This was a local innovation from Swansea University Health Board and their developers have worked alongside the national team to develop this system. So true collaboration. But I think the thing that this project actually demonstrates is an exemplar, in my view. It's strong leadership and strong collaboration, and actually that the support and the placing the importance on the professionalism of nursing informatics at the heart of this, actually. And then the way that the project has actually been taken forward, that strength of teamwork, it's just quite powerful, actually, when you see the digital teams and the nursing teams sitting down side by side as one team. And actually now, Judith, talking the same language, actually, that's on both sides, I think. There's been that kind of cross-pollination of kind of that understanding. And I just think, you know, and then to have that topped off in the last couple of weeks with the winning of the Health IT Project of the Year at the UK IT Industry Awards is just such an accolade. And I'm just, you know, all of the teams should be so proud of themselves for all that they've achieved. And I just think, as Fran has said, this is the beginning. There's a lot now that we're really laying the foundations of the digital ward through these implementations. You know, we will build and hopefully be able to move forward at pace. But yeah, just want to say how great it's been, and to thank you guys for all you've done.
Great. Fran, did you want to pick up on the timetable? And I've got Rowan who wants to come in.
Yes, absolutely. Every health board across Wales is going to implement the Welsh Nursing Care Record. So we're actually live across 5 health boards at the moment. And obviously there's varying organisations within the health board. And, you know, like Judith mentions, there is actually 1 health board that's live today. Singleton went live this week. And then the next 3 health boards to go, which are Cardiff and Vale, Anara and Bevan Health Board and Betsy Cadwallader, their plans are to go early, to start implementation early to the summer next year, sorry. Yeah.
Thanks, Fran. Rowan.
Thank you, Simon. And congratulations, Francis and Judith. This is an outstanding story. And I really wanted to ask you to provide a little colour on what accuracy and availability of this information means to your nurses. We've heard a lot about on the wards, and clearly the nursing profession has become a lot more technical over the several last decades. You know, there's a lot of processes and care that the nurses carry out directly. But as we look to a healthier Wales and trying to maintain the health in the community, you know, what plans are there for the nursing care record to support care in the community, which we heard a lot about? Well, I think it was specifically part of my interview for this role, was it was already making a difference with district nurses. And what plans and do you both see going forward beyond the initial implementation, that this capability is allowing you to do more and support the whole of the nursing community in Wales?
So Judith, do you want to go on. Judith, do you want to answer initially from a health board perspective?
Yes, I'm sorry, I missed the early part of the question. Was there something before the community aspect? Sorry.
How brilliant the project is, I think, was the first bit of it. Yeah.
Yeah, I mean, certainly, yes, there are plans. As Fran said earlier, we're working closely with the community teams as well as others, but utilising the data standards that are being developed at national level, so that where they're applicable and relevant to the care setting, then certainly within the WCCIS programme, the relevant data standards will be used there, so that there's a seamless you know, okay, we've got to wait for the interoperability with the systems, but from the record point of view, there'll be standardization across those two records, which are now being developed as we speak by that team. Hope that helps on that front.
And also just to identify, currently, even now, the documents are available as soon as the patient is discharged within a digital system. In fact, it then goes into the Welsh Care Record Service and makes it available for anybody across Wales to see. So for, one of the key benefits thus far is those documents are now being viewed across healthcare borders, and actually the biggest user of that is Velindre Trust, because they are now able to access information of not just their cancer journey, but, you know, potentially there are maybe issues outside of their cancer journey that are now available to them. So it's enabling those conversations with patients to be able to say, oh, I see you've been in hospital, you know, and also for our district nursing colleagues, they can see all the care that was provided within secondary care. So actually, when they're triaging that they've got to, that they've been referred a patient, they can see that document. They haven't got to wait for the patient to bring it and show it and give it to them. They can view that to be able to plan their schedules and their patient care throughout that journey. Thank
you, Fran. Rydian.
Yeah, just wanted to come back on a few things that have been raised by independent members. One of the real exemplar elements of this program was the collaboration to standardize the information that's collected for the same thing in different care environments. And I can't overemphasize how important that has been in determining what it is a healthcare professional needs to collect to do the thing that they need to do at that time. In terms of the future, I think there are some really exciting opportunities implementing clinical decision support and various pathways where you ask questions that present patient responses where you may not have time to do it at that point. And a good one would be smoking cessation. Most people who come into hospital are asked, do you smoke? Most people are advised, please don't smoke. But the nursing staff don't have the opportunity there to spend lots of time explaining to them how they might get off smoking. However, the ability to use a system to signpost patients, collaborating and joining up with the quite exciting digital services for public patients, the ability for patients to self-manage their problem may mean that we can put markers within their personal accessible health record that signpost them to things that may help with smoking, with diabetes, with weight reduction. And I think there are some really exciting opportunities that we will work with stakeholders within the NHS and those that are approved and trusted to provide supportive care in the community to improve self-management. I can only see benefits from this going forward.
Thank you, Ridin. Anyone else got any comments? Okay, well, can I thank you again, Fran and Judith, for presenting something to us this morning that we need to be collectively, both ourselves in DHCW and our colleagues in the wider health system, shouting about as loudly as we possibly can, because clearly it's a huge success that will bring huge benefits to patients, public, but also to staff and to nurses. And we know, very much, a lot of noise around now about how tough it's been for nurses over the past 18 months, and where digital can help their working lives has got to be a good thing. So great, thank you very much, both of you, for presenting that, and I'm sure we're going to hear more about it in the future. If I can move on then to my report, but before I just pick out a few things from the written report which has been in your papers, I've got a sad duty to perform now, which is to say that one of our independent members, Sian, will be leaving us. This is, in a sense, very good news for Sian, because you may have seen in the news that she was recently appointed the next chief executive of Bwrdd, the Welsh Fourth Channel. So many congratulations on that, Sian. It's a hugely important institution, both culturally and economically in Wales, and I'm sure you feel it's a huge honour to have secured the role and going into the role. And then the next sad thing is they want Sian very quickly. So it means that Sian, I think that we have to go through a process of approval for the minister in terms of finishing, but I'm certain that won't be a problem. But Sian will be finishing at the end of this month, and we'll are having discussions now in terms of kicking off the process of recruiting someone to fill very difficult shoes to fill. So thank you very much, Sian, for all. I mean, I've only known you for a couple of months, but it's been great, and your contribution has clearly been huge towards the establishment of the organisation, and your role in the governance committee as well. Hugely important. We are having conversations with Sian about how we can stay in touch, because we wouldn't want to lose her expertise and her skill and her experience. So best of luck with your future endeavours, and we'll all need to now make sure we start watching S4C and get your figures up.
Diolch yn fawr, Simon, yn allai jyst weud gymaint wedi mwynhau gweithio gyda'r bwrdd a'r tîm, a mae amser mor gyfroes o flaen DHCW, a dwi'n gwybod fydden nhw'n llwyddiannus. Mae'r progres o mis Mawrth jyst i nawr yn anhygoel, so pob lwc Helen a'r tîm, a fyddai yn colli chi, ond gobeithio gallai aros mewn cysylltiad. Diolch o galon.
We will be staying in touch. I can assure you of that, Sian. Just a couple of things to pick out from my report. You'll see I've been meeting as many people, both internally and externally, as possible in the first 7 weeks, and I'll be continuing to do that. Engaging with important stakeholders externally, but equally getting to know as much of what we do and as many of the people working within DHCW as possible, which is a bit challenging in these circumstances because it's difficult to meet teams, which you would normally be able to do in terms of walking around an office, walking around the location. But I'm very keen to make sure I do as much of that as possible. And then another really strange experience is I joined Helen on the staff briefing, just to say a little bit about me and a little bit about what I was hoping the aspirations, ambitions for the organisation. And it's very odd when you know that there are 300 plus people out there watching you and you can't see one of them. But it was there was that opportunity in that for conversation, for engaging in questions, and again I hope I'll be able to do that again in the future. And that was an enjoyable experience in talking to so many people at once, if albeit in the circumstances quite a strange one. I'm pleased to say, and this is something that Bob kicked off and did most of the heavy lifting and the work on, the establishment of the independent member digital network has now gone through the processes with all the health organisations in Wales, and we have, I think, with a couple of exceptions, and that's largely because, well, I think it is not largely, it is because they don't have ICT independent members in place. We've got an identified person from each of the health organisations in Wales to join this network, and 3 of our independent members will be part of meeting as part of the network. And I think the aim, Chris, is that will meet for the first time early in the new year. Well, that's great news, and we also, which is very nice to see that the minister welcomed the establishment, and I think the letter is in your papers, welcome the establishment of the network, and we know how important and what a priority digital development in health services in Wales is to the minister. And the final thing I draw to your attention is the ever-groaning mantelpiece in Helen's house as another award. She was got the award as the CEO of the Year Award at Digital Health Awards in early October. But I know Helen will be the first to say that, yes, it's a recognition of what a wonderful Chief Executive Helen is, but it is as much a recognition of the huge efforts and success of all staff within DHCW. So it's not a Helen award, it's a DHCW award, but it's probably on Helen's mantelpiece. So I haven't got anything else to pick out in my report. If anyone's got any questions, do put your hand up. If not, I'll move on to your report, Helen.
Thank you, Chair, and Bwrdd da, Bob. Just a few highlights from me, and definitely just to kind of reiterate, the award is the recognition of the accomplishments of the whole organisation, and it's been fantastic. And to be recognised as an organisation for all of that that we've achieved really over the last 6 months and the year prior to that is just a really proud moment. So yeah, thank you all. Just a few highlights I thought I would share with you from the last couple of months. So you've been briefed on the major kind of transition of the move of one of our data centres to the new data centre. I'm pleased to say that all of those 8 batches of weekend moves have now completed. We've got the last 2 services now that are remaining, but actually one of those has successfully migrated to the cloud this week. So it's just one remaining service that we're working through with the data center provider and the supplier of that fully managed service to move that when it is the appropriate time. But yeah, very successful outcome to what has been quite a challenging and large scale program of work to transition in the way that we have. So yeah, thanks to the team that's been leading on that and the support that we've had from colleagues right across the board. E-prescribing, we've talked about this quite a lot actually. So we're now pushing forward with the recruitment. We've appointed a program director, a program lead and the program architect, and a number of other roles are almost daily being interviewed and appointed to build the teams that we need across what is actually a portfolio of programs, so a massive transformation program. So yes, so and also early work from the teams already within DHCW and out with the service really, and the programs of work that were already in place to actually progress some of the early priority areas such as electronic prescribing and meds administration for hospitals, and of course the electronic transfer of prescriptions in primary care. And on that latter one, we're working with colleagues in NHS Digital and in exploring the use of the electronic prescription service that's been highly successful there for some time. So great support from Simon Bolton, who I've met a couple of times actually. I met him last week as well with some of his team to progress that support really to take forward the discovery work and also the support that they're giving us on the code base and the approach for the NHS app really to take forward and support the priority areas of the digital services for patients and public. So really encouraged by that moving forward. And the exec director recruitment is well underway. 2 executive roles, the post closed on this week. So we'll move forward and through those stages to get to interviews at mid-December. Yeah, really encouraged by the volume of applicants and the caliber that we've seen to date. So yeah, I'll keep you posted on that as that progresses. We're also out, I should note actually, that went live this week for our Director of People and OD. So that recruitment opened with a view to interviewing towards the end of January to appoint a successful candidate. So lots going on in the recruitment space. It's also felt a bit like conference season actually. So you'll have seen kind of not just my picture, but a number of colleagues kind of popping up on social media, I'm sure, with conferences and seminars that have been going on. A couple of those actually to draw out. Quite a successful briefing session I did with alongside Ivan Evans, the Director of Technology Transformation and Digital in Welsh Government, to the industry, to Tech UK industry. So, and actually really well received. We're quite taken aback by how well received it was actually, to share with them what we're doing in Wales and actually what we're looking for and where the opportunities are going to be going forward. So we will be looking to do more of that actually, and actually to have perhaps Wales focused events in the future. So they're really keen as a trade association to work more closely with us on that. So that was a good one to be part of. Value and Health Week. I think what a celebration that week has been, and commending the programme there under the leadership of Dr. Sally Lewis, who's the national director for that programme. I was asked to be part of the keynote session alongside the Minister and Ivan Evans and Sally, to set out really what the role data and digital has to play in the success of a value-based healthcare system. And I'm pleased to say that kind of theme of the importance of data and digital actually was heard quite a lot actually through the week, was quite a strong focus of the sessions, but I think highly a successful week. And it was great to see some of our team, Sally Cox in particular, who's the principal analyst as part of the value-based healthcare analytics team here at DHCW, being part of that and being able to share the great work they're doing. So really congratulations to the team really there. I've also been asked to now pick up as Chief Executive a lead role for the Chief Executives to link into the Respiratory Health Implementation Group. So I'm looking forward to getting more involved in that area. Also, colleagues may have noted that on the 11th of November, we had an issue that affected GP practices, and we had an issue, a power outage in the data centre that for most things was able to be rectified almost without effect on end users, apart from a number actually of our GP systems. So our team here worked with the system suppliers and the data center providers to rectify the issue as quickly as was possible, and services were restored within that day. We will be looking, as you would expect, really undertaking a full review, and lessons learned will be going through our organisation review and learning group. And then, yeah, the nursing care record actually, just to say how proud we are. We've heard all of that, and I can't actually emphasize enough what a pleasure it was to do that visit. And when we're able and when it's safe, I would encourage other members of the board to actually get out and about and actually experience and hear for themselves really what a difference some of the digital implementations and the systems and services that we're providing are making. So yeah, that was it from me, Chair. Thank you.
Thank you very much. Helen, is anyone? Oh, yes, Ruth.
Thank you, Simon. Thank you, Helen, for that report. Lots of really good news that we should celebrate for us in DHCW. So thank you for that. I had a question about recruitment, and particularly about our exec director recruitment. I'm really conscious that to be the best organisation we can, we need to improve diversity at all levels in DHCW. And this is a real opportunity for us at exec level and director level. So I wondered if you could just talk a bit about what Global is doing to help us with that, and what our candidate pool is looking like in terms of these roles?
Yeah, we've got a breadth of diversity in terms of the applications that we've had, and we did ask Global to make sure that that was kind of a focus really, but also in terms of the approach from the candidates themselves in terms of their kind of approach to equality and diversity. So I'm confident we will get a feel that allows us to choose the best candidates that we can from the breadth of that we have to choose from.
Thank you, Ruth and Helen. Any other comments or questions? Okay, so we'll take a short break. It's just after 5:02, so if we come back at 11:05, and if you could please turn off your videos and sound and mics whilst we're on the break. So we'll see you back here at 11:05. Thank you. Okay, let's reconvene, and we're moving into part 5 of the agenda, and there'll be another short break after this part, and we will take it after this, regardless of what time we get to. So we're looking at some strategic items here, and Helen would like to kick off to introduce this section. Helen.
Yeah, thank you, Simon. So this session is a focus on some of the strategic developments that are underway for the organisation, and in support actually of the developing integrated medium-term plan, which Michelle will finish the session with an update on. We're also joined for this session by a number of colleagues who are working on these really, really important strategies that we're developing that kind of underpin the foundational layers of our strategic direction. So that's about actually the support of us moving to modern infrastructure. So Claire's going to give us a bit of an update on the cloud strategy to start with, but also we've been joined by Rebecca Cook, who's the Programme Director for the National Data Resource, Rob Jones, who's our Chief Architect, and Ian Williams, who's the Assistant Director of Architecture, to actually talk us through the architecture strategy and the developing data strategy work that is happening. But to start, and I think actually the importance here is how all this comes together to actually provide kind of the underpinning foundational strategies that we need, and to kind of create that path, if you like, for the way forward for the organisation and the opportunities that provides. So without further ado, actually, I'll hand over to Claire to kick off this session with an update on the cloud strategy. And then Claire, if you hand over to Rob, I think is next then.
Okay, thanks, Helen. Okay, so there is quite a lot of work that we've been undertaking since I last updated the board on the strategic principles around cloud. The area of focus that which are taking quite some time, actually additional time than we really initially assessed, are really around the implementation plan of the cloud strategy, and in particular the FIT, and I'll talk a bit about that in a minute, the governance arrangements around the cloud strategy and how they align to our current processes, and then the commercial strategy and plan that underpins all of this. So I'll touch on each of those in a minute, but once we've got all of that, then we can then finalise the strategic document and the business plan that will underpin and bring all of that together. So the work stream, we meet regularly on a Friday morning, but what we are looking to do is breaking into work streams. The first one of those is the implementation plan. And really there are two aspects that make up this plan. One is the new developments and new requirements. And the important thing here is the governance process and design that support any new cloud associated developments. And currently we're looking at the technical, commercial and financial considerations that would need to be in place in order to assess any new development. The second part of the implementation plan relates to the legacy. Obviously, currently we have a significant on-prem products and services, and the ambition and pace that we will switch to cloud needs to really reflect and align to the infrastructural plan and priorities, and align again to the IMTP. So we've actually had a workshop with the senior leadership team to really try and understand how we enable all of that, but do it in a coordinated and sensible way.
And really some of the key next steps on that is really to agree our data centre assumptions which relate to our infrastructure plans in the IMTP. So we are currently doing an exercise to substantiate what that legacy implementation plan would look like. And then that would then feed into the resource and business case and the IMTP going forward. So in relation to the implementation plan, there's quite a lot of work that we're currently doing now, getting into a bit of the detail to really substantiate and validate our aspiration around the pace at which we could implement cloud. The second aspect really relates to the governance work stream. So here we've really tried to look at doing it in a lean and efficient way, and to understand how it would fit in relation to our current processes. So we've initiated a workshop to try and understand how this will align to our current WIAG process, which is our assurance process in relation to any informatics or developments. And equally within that, to understand how our financial governance will adapt to that. So that's really looking about the key plans, controls and reporting requirements as we move to cloud. And then there's also the commercial aspect, which I'll touch on in a minute. And the other aspect that we need to consider is our current skills and knowledge gaps to enable that governance process to work efficiently and to ensure that we make the right decisions. Within that, then, there is also a speed in which we need to consider the new developments so that we can have it in place to align with some of the national data resource work that we'll touch on in a minute. So, so work on the governance work stream is underway. The other aspect that we're spending a bit of time is really looking at the commercial strategy. So the team has recognised the complexity and difficulty in enabling us to scope this, given the diverse requirements and the capacity requirements that we're currently now working on. To support this process, we've employed an expert to help us structure the requirements in a commercial, digestible manner and link it into the overall business plan. So in summary, the Cloud Group has made significant progress in understanding the scope and requirements to enable that cloud-first adoption strategy, but it's really focusing now in key areas which we've highlighted before, which is the governance, the implementation plan, and the commercial strategy, which will then inform the final financial strategy, which will be completed later in the year. So that's a very sort of high-level update on where we are in terms of the underlying cloud strategy. I'll now hand over to Rob. That will
I think it might be easier, folks, if we just took a breath after each section, and because otherwise the questions could get terribly muddled, and so not knowing what question is addressed at which bit. So, has anyone got any comments or questions to David?
Thanks, Claire, for the update. Could you just give me a view on the timescales for developing a strategy and then bringing it to the board for approval?
Yes, so the implementation plan will have to be complete by January to align with the IMTP. And the commercial strategy we will work on alongside that, and we're hoping to get that complete probably realistically towards the end of February. The governance structure, again, we'll be working on we hope to have the workshop in December, and probably following that, refine that. So I think we're looking at trying to get a deadline before the end of February to bring all of those threads together and reflect all of those outcomes really in that finalised business plan.
Claire, can I ask a question? Helen may be placed to answer it, and I probably should know the answer to this, but where are we in terms of Welsh government policy around cloud and use of cloud? Because obviously, you know, developing a strategy in a vacuum is tricky, but developing a strategy within a known policy becomes much easier. So where are we?
So cloud first is the is kind of the statement out of Welsh Government. But actually in the setup of us as an organisation, within our functions, the expectation was cloud first and drive into a cloud first environment for the delivery of digital services. So it's almost an instruction to us rather than it being policy, to be honest, Simon.
Thanks. Anyone else before we Thank you very much, Claire. If we move on then to the open architecture strategy update, and we're joined, as Helen mentioned earlier, by Rob and Ian, who I can see are both here. So I don't know who's going to kick off. I'll leave it to you.
Yeah, I'll kick off if I may, Chair. Yeah, and look forward to chatting about this this section. So during the latter part of 2018, Channel 3 were commissioned by Welsh Government to review the digital architecture in Wales, to establish its readiness for meeting the expectations and ambitions set out in a Healthier Wales to support digital transformation in health and social care across the nation. Their review was undertaken first quarter of 2019, and the published review was shared with the service in Wales through that summer and the early autumn of that year. Their main recommendations were to adopt a standards-based approach to deliver an open architecture, and in doing that, identify a series of what we call architectural building blocks that, once delivered, will become the foundation on which current and future applications and digital services in Wales will be built. Work on the response to the digital architecture review in 2020 was severely impacted by our need to assign DHCW and National Data Resource architects to COVID work to meet requirements and expectations of those impacted by the pandemic. And that seriously impacted on how we were organised to actually meet that review. But I'm pleased to say that in 2021, we've been able to regroup and have worked alongside the National Data Resource Programme on the response to the review, which has allowed us to define strategy roadmaps for 14 architectural building blocks, and these are listed in the accompanying document. With the exception of the building block document for images and the image archive, we've been able to present these to a range of NHS Wales and wider stakeholders during a series of virtual roadshows that we ran from the 6th of October to the 20th of October. So 12 half-day sessions that were recorded and written up, which included feedback, comments and questions and answers made during those sessions by the attendees. And I'm pleased to say that each session was very well attended. We had an average of over 100 people per session attending, with representation from the local health boards, from various trusts, so Welsh Ambulance Service, Bwrdd, Public Health Wales, as well as colleagues from Digital Health and Care Wales and colleagues from Welsh Government too. A summary of the building block strategies has also been presented at the National Data Resource Technical Steering Group, its Programme Board, Welsh Technical Standards Board, and the Welsh Clinical Informatics Council. And we've had enthusiastic support for the approaches documented coming from all of those groups and boards. So work is now underway on our next steps, which include reviewing and consolidating all of the feedback from the sessions and updating all of our documents, publishing those on a SharePoint site so that colleagues can go in and actually review those at will. Completing and presenting the building block for the images and the image archive building block by the end of December. And then running workshops to prioritize the delivery of the building blocks and determine delivery plans, which again, we look to achieve by the end of December. We'll then look to publish the final versions of all building blocks as statements of record and statements of strategy by the end of January, and bring that back to this board for approval as a final series of strategy documents. And then into the new IMTP, initiate the work to actually prioritize the building blocks into the IMTP for delivery. So I would ask the board to note what we've been doing and our approach to establishing an open architecture and responding to the recommendations of the Digital Architecture Review. Thank you.
We'll take any questions now for Rob and the team on that bit.
Sorry, it had to happen once today. My microphone was off. I do apologise. David and then Rowan.
Hi, Rob. Thanks for the update. Much appreciated. I noted in the report that was submitted, there's a bit of work still needed to be done on the data and analytics building block. And just wondered, we probably don't have a requirement for it immediately, but at some point in the future, we might want to process time series data. So are you planning to take that into account in the building block, even though we might not need it in the near term?
Yeah, I think so. I mean, David, we've talked previously about near real-time movement of data from operational systems and then into things like the NDR for the availability of that data to achieve more than just the operational perspective on it. That's very much part of our thinking. I think there are elements that might come out in the data strategy to support all of that, but that's very much where we are on this.
Right.
So movement of data, not in kind of batches at the end of an accounting period, for example, but in near real time to support a variety of use cases.
Thank you, Rowan.
Great, thanks, that's helpful.
Rowan.
Thank you, Simon. Great update, and delighted to hear that we're now getting back together and eyes down on the open architecture, because this is really the skeleton that is going to allow all of the systems to come together and talk and deliver the vision. Some of the things that we heard Rydian say earlier about moving on from the NDR, etc. So this is really exciting. What can the board do, or how can we help support the success of the implementation phase? Because architecture is a little bit invisible, and the skills to implement it are scarce. So how is there anything that the board should be aware of or be doing to support you and the team and the wider DHCW community be successful in the implementation phase? Because we want to see it done well and to the standards that you're setting out here that sound absolutely bang on.
Yeah, it's a great question. Yeah, architecture is under the hood, so to speak. It can be considered as a little bit dry and perhaps a little bit obfuscated from what people would normally expect to see in the application space, where they can actually see and touch something tangible. I would ask the board to spend time with us and actually understand some of the things that we're trying to get through and grapple with. Okay, so not necessarily in as much detail as we do, but be aware of it and try to evangelize it to the colleagues that you engage with. That would be perhaps the biggest help that we could have, so that people are actually aware of it, that they become aware of the fact that architecture exists. It's not just about applications and how those applications knit together. The architecture is the underlying foundation for all of those transactions to make them doable. So that's what I would look at, Rowan, if that's possible.
Indeed, as you were talking there, Rob, I was thinking, right, okay, Rob and I need to have a conversation sooner rather than later, so I understand what's going on and do what you described very well, evangelize.
Maybe
Helen.
Something for the independent member network, Simon.
Oh, yeah, absolutely. I mean, when we're starting to populate that agenda, I mean, I think these very practical things that are really important but perhaps don't get the airing, it's not really excellent opportunity to give them an airing. Indeed. Helen.
Yeah, so Rob and Rowan, it's all of my thunder actually. So it was exactly that actually, in terms of that, evangelizing, actually being able to describe why this is so fundamental to all of us across the health and care system, and why our focus on this, collaborating with our partners and our colleagues, is absolutely kind of the backbone, as you describe, Rowan, to us being able to create the platform from which others and all of us can innovate and actually have more choices in terms of digital channels and digital innovation and transformation. So, and it's, you're right, it can seem quite dry, can't it? But it's absolutely pivotal to achievement of the strategy and the direction of travel. So that understanding and that sharing that across networks, and particularly kind of early doors in the IM network, I think would be really helpful for Rob and the team, definitely.
Thank you, Helen. Any other comments? I mean, obviously you do
come in briefly as well.
Yeah, please do, Ian, please do.
Yeah, I just to add to what Rob and Helen have said, really, because the architecture is something that sits out of view, really. It's the foundations on which we build so many of our services. Sometimes then it can slip in terms of priorities. So I think the help of the board in keeping us honest on this and keeping it as front and centre as a priority because of all that it will enable for us, but also the assurance element of the board as well. I know there are there's some real expertise amongst the independent members, and I think the assurance that you can bring to that strategy and the outside view that you can bring will be really helpful.
Indeed, thank you, Ian. Now we're asked to note, as with all these reports, to note it. I think we're doing something more than noting. We're very much recognising the work that's gone on and welcoming the report on that we're getting this morning. If we move on then to the next update, which is around the National Data Resource Strategy, and we've been joined, and I see she's there, by Rebecca Cook, who's the Programme Director, and I think, Ian, you might be singing for your supper on this one again as well. So over to you, Rebecca.
Thank you, Simon. Thanks for inviting us to the board meeting today. My name is Rebecca Cook. I'm the Programme Director for the National Data Resource Programme, came into post in June of this year. I think it's fair to say that the NDR is a really ambitious and one of our biggest sort of strategic programmes going on in Wales at the minute. And actually one of the positives of the COVID-19 pandemic is that it's shown us all really how important data is to us and how important it is to be a data-driven health and care service. We suffered as well from diverting resources to respond to the pandemic. And as a result of that, we obtained approval from our board back in September to commission a partner to work with us on our data strategy and to enable us to accelerate really the delivery of the data and analytical capabilities for Wales aligned to our strategic aims. So we have data architectures today. We have local and national sort of warehouses of data and data stores that live across our health and care system, and we've set out a really big ambitious vision really in terms of establishing a national data resource, and the strategy really is about helping us to set out that sort of as is landscape for data and actually where we need to be, and those target architectures and governance structures that need to be in place to realise really the benefits of the programme. The paper sets out the stages of the work over a 12-week period. We are approaching the end of week 4 at the moment, so some key highlights. We have engaged with over 45 stakeholder groups across health and care providers, both in primary care, secondary care, community, social care, as well as academic partners that have a role to play really in data across Wales. Those engagements, of course, are supplementary to the reference materials that we had prepared in advance of the project kicking off, and those are materials that we have developed throughout the NDR programme in terms of requirement solicitation, but also some of our strategic reference materials around a healthier Wales and the value-based healthcare programme and the national clinical framework, all of which have huge dependencies on the delivery of our national data platform. We've stood up a team who are working in partnership with Gartner, and we have daily stand-ups, we have weekly reviews. We have seen some extension to the delivery phase of the project plan, but we have been able to confirm that there is currently no slippage to the overall plan, and we are on track to deliver within the time and cost that we have put in place. I think that's it for me, Simon, in terms of an update. The detail is in the paper. I'm happy to take questions from the board.
Great. It's nice to hear that you feel you're on schedule, because it's a challenging timetable you've set yourself, isn't it, on this? So is there any comments or questions? If not, well, thank you very much for that update, Rebecca, and and you've got a busy Christmas because you've got that period in the middle of that 12 weeks, haven't you? So thank you very much indeed. And we welcome that report and note it, and move on then to the next one, which is Michelle, you're going to update us on where we are with the development of the IMTP for the next financial year, 22-23. Over to you, Michelle.
Thank you, Chair, and good morning, everyone. So there is a plan and there's a high-level paper. I was just going to call out some key points really in terms of where we are. Pleased to say we have received the NHS Wales Planning Framework Guidance now, so we got that a bit earlier this month. I think it was slightly later, perhaps, than Welsh Government would have planned, but we understand that the Minister was really keen to ensure that the priorities were clearly set out. And obviously, as colleagues will understand, the environment in Wales is still changing quite a lot at the moment with the pandemic and other factors that we need to put in place. So the good news, I think, is the guidance wasn't really a surprise to us. The priorities have been quite well articulated, certainly from the ministerial level right through Welsh Government. So that fitted with the direction of travel that we were taking. So the other point to note there perhaps is that the deadline for submissions, perhaps because of the slightly later issue, is now the end of February, but our proposal to the board is that we still work to the January board date. So that's the plan that we developed. We've got a little bit of contingency then, but I think if we can work to the January board, then that's the plan we set out for ourselves. So that's what I've asked the team to do as we move forward. So just a couple of quick points then. Obviously we met in September, we looked at our key priorities as a board. And then we had the session in November looking at the drill down below that, the delivery statements, we call them, all the blue boxes they call them in the team, which hopefully paints the picture in people's minds of that image, the visuals that we looked at in terms of the plan. So those set out our key portfolios, and I think that still works. Really interesting, and hopefully you'll start to get some of this alignment now with colleagues coming today. You can see talking to some of those key portfolios really, and the strategy developments that sit underneath those. We're also a lot of engagement going on again. You know, colleagues have talked about some of the workshops we've been running, the engagement on specific issues. We're still continuing to meet at a senior level with Health Board colleagues. We've then had more detailed discussions in terms of aligning our plans really more closely with the Health Boards going forward. I think those conversations are going pretty well. We've talked about this before. It is tricky because we all do our plans in exactly the same timescale. So achieving alignment, perfect alignment, is challenging, but we're continuing to work on that. And we've had some really good conversations with other national colleagues as well. I had a session a couple of weeks ago now with HIW, one of the other national organisations, obviously looking at the workforce. We're working closely with the Health Collaborative and the shared service. So some of their challenges are similar to ours in terms of national deployment. So we are working hard at achieving that alignment really. So what are we doing as a team, or what are the planning team leading? And this operates right across the organisation, I want to say, and colleagues doing an awful lot of work at the moment in terms of the thinking and the development of the plan. We've set the objectives, so this would be under our sort of portfolios. We've got then a layer of key objectives that we want to and milestones that we want to deliver across the 3 years. We tend to focus more in year 1 and then at a higher level in years 2 and 3. And again, a reminder to colleagues, there's a slight irony. We actually submit the plan every year, even though it's a 3-year plan. So we do have the opportunity to refine years 2 and 3 when we get to them. So a bit of an interesting dynamic in the planning, I think. So we've set those milestones, and where we are at the moment now is we then share those across the organisation. And those milestones include the identification of the resources that we think we need to deliver those. And those are now out with the teams to say, you know, do we have the capacity to deliver those or not? I mean, recruitment's already come up. It'll probably come up again in our conversations today, because we know we're still you know, working hard, I think, to get up to the level that we need to be as an organisation. We're not quite there yet. So the brief that we've given to people in assessing the capacity and developing the plan is develop on the basis of the resources that you have. So try and be quite realistic. I know we've discussed this as a board as well about what we're able to achieve, so that we get to a plan that we're all comfortable with, and you know, we're comfortable that we've got the capacity to deliver against. So that exercise is going on at the moment. We will look at that in terms of a management team, and we'll have a number of runs through that to make sure that we can land the plan properly. And then as a board, we've got a development session in early January. So my plan at the moment is we will bring the more detailed plan to that development session, so that as a board, we can have a look at that. We can take a view as to whether that fits in terms of what you know, we want to deliver. We can make sure that we are comfortable with what's being set out. And then there's an opportunity for some refinements around that before it comes to the formal board then towards the end of January for the board's approval, with a view that it's then submitted to Welsh Government. So on track, lots of work to do, lots of work going on right across the team. So I just want to thank, I know people are working really hard on this across the organisation at the moment, so that we can get a plan that we're all confident that we can deliver.
Thank you very much, Michelle. Sian.
Diolch, Michelle. Thank you. Quick question from me. I'm really pleased, and probably a comment. I'm really pleased that resource is going to be properly evaluated as you go into the IMTP, because and the skill set, because those two things are going to be critical for your success over the next 2-3 years. And calling that out, and I would love to see that, although I'm not going to be here, I'm sure everybody else would love to see that being called out specifically in the IMTP, because these are things that are not going to happen overnight, so therefore prioritization will be absolutely critical. And perhaps my question would be, how are you going to think about communicating that to your stakeholders and so on going forward, because it's as much as what you can deliver as much what you won't or be able to prioritize, especially as we still have the pandemic very much on the agenda. So that was my question, really.
Do you want to pick that up, Michelle?
Yeah, and colleagues may want to come in. I would absolutely agree with you. It's a challenge for us, I think, how we set our scope, isn't it? And we've talked about that in terms of our strategic scope and in terms of the scope of our plan specifically, so that we're confident that we can deliver, but we're also meeting the expectations of our stakeholders. And I you know, personally, it feels, I think on the expectation front, it will always be wider than our capacity to deliver at the moment, because there are so many opportunities in this field, aren't they? And those are the kind of conversations that we're having in the strategic sessions with the health boards and trusts, particularly. So, you know, where are the really key areas we think where we can focus and have the biggest impact? What are the key challenges from their perspective in terms of the care delivery programme? You know, and how can we try and, you know, align our resources to achieve the most and to really target those areas. So those conversations are ongoing, to be honest. And I think it also links to how we will develop our strategy going forward and set out where we see our really core scope and where we're going to focus resource and some of the key areas. I mean, we just talked about around the, you know, architecture and the data space. I think that's where, you know, we will increasingly focus, personal view, and perhaps in some other areas we're then working with the health boards to enable them to take forward, you know, other initiatives and areas of priority. I don't know if Helen, did you want to comment on that?
Yeah, I think Helen's got a hand up.
Yeah.
Yes, thank you. Yeah, concurring again, Michelle, really, and I think the development of the roadmaps for each of our product and service lines actually is absolutely key to that, and really understanding kind of where services are heading and what choices that we've got in terms of supporting that through digital, either optimization or transformation, and being really clear about that. Collectively being really clear about that, and it as an organization, it's not about us prioritizing on behalf of everyone else. It's a collective endeavor, really, that we are actually all pushing towards the kind of meeting the same objectives, and we're doing what we need to do for the local services to be able to do what they need to do. So so that's getting clearer, I'd say, Michelle. Previously, with all of the engagement that we're doing and all of the collaboration that is happening, really, but it's, yeah, it's, you know, it's tough, isn't it, in terms of the expectation is huge. The priorities are really all really important, but we've got, you know, that's the job, isn't it, for us to actually make sure that we prioritize in the right way with our partners.
I was just going to come out. I think for what it's worth, I think in order, we've talked as a board that we want to become a trusted partner. Well, a trusted partner gives good news as well as bad news, right? It's not always going to be, the supplier will always say yes, a trusted partner will be honest and transparent in terms of expectations. And I think that dialogue you're having is so critical and valuable now in terms of everybody understanding, because not all of this is visible, right? Some of it's not going to be the sexy stuff, but it's absolutely essential for the foundation of digital going forward. So I commend you on the work you're doing. I think it's real good progress.
Yeah, I think this is such an important issue for us in terms of, and in our engagement with not just the health system, but government, local government, is that there is we align strategies, which is going to be challenging in itself, but also this bit about getting everyone on the same bus in terms of what the priorities are and what comes first, because the ability that for health board there will have a different priority than health board there, but we actually need to manage expectations. So it's a real challenge. Absolutely. Carwyn, you wanted to come in.
Yeah, Josh, just very briefly, really, to say that, amongst all of the requirements that we've got from outside that want us to deliver new things, we have to keep upgrading and sustaining the things that we've already got. So, there's an awful lot of work going into that, as in, well, and it's not just sustaining what we've got, it's changing some of the things that we have as well. Like, Claire mentioned later on where we are with the cloud work. That's a substantial bit of work to take our on-premise systems and move them into the cloud. We have to upgrade things constantly as well. So all of that is going into the mix along with the new requirements from outside.
Thank you, Carwyn. Anyone else want to come in at this point on this this bit? No. Thank you, Michelle, but don't go away because I think you're on next again to take us through the strategic procurement report. So I'll hand over to you, Michelle, for this.
Yeah, thank you, Chair. I'll change hats. The strategic procurement report, I've got 4 contracts that I'm presenting for the board's approval to award today. So these are all our strategic contracts over the threshold that requires specific board approval. 2 of them relate to our e-library services. So these are services that we provision across Wales for a wide range of stakeholders, actually, to provide evidence and support to enable care. And 2 of them relate to, it's actually a nice little segue, Carwyn, there, to maintaining our WPAS services ostensibly. So this is a kind of an upgrade to some legacy to maintain performance against services. So again, we've got the papers in the pack. I was just going to call out a couple of key points, I think, for the information of the board. So the first contract, which is the end of year journals, I must say I have asked them to change the name, if I can just drop it in. We call it end of year journals because we procure them at the end of the year. I did ask the question, why are they called end of year journals? That sounds intriguing. So we'll be looking at that in terms of labelling, I think. So just for the board's benefit, there's nothing too scientific in that. But these are essential services that are provisioned across quite a wide group of users. So this is a 1-year contract, the first one, which is for journals. The reason it's for a year really is because the requirement and the demand from the service changes during the period. So we have a service management board who regularly monitor access. You look at new journals as they become available, you look at others perhaps that aren't getting as high usage, and we reshape the package. So we do go to the market fairly regularly on this one to make sure that we've got the right mix of journals available. So we procure, hopefully, the National Institute of Health and Care Excellence have put together in England and other health bodies. So they've put that together. So we procure under that framework, which sets out terms and conditions, pricing, suppliers, etc. And the procurement team, as I mentioned, we've got an in-house team who look after the library service. We've also got a service management board, which has got subject matter experts and kind of key service delivery folks from across the health boards and trusts. So they delegate authority to a small team who ran the procurement and have made this recommendation. We're awarding to 5 suppliers to reflect the mix of journals really and the role of publishers. And probably the other point just to say on that one is the funding. So we have specific funding that supports the library, which has been confirmed, and this would very much be a part of our plan. So in terms of resources, as I say, we have a dedicated team who support the library on our behalf. So I don't know, Chair, did we want to take these one at a time? I'm looking for approval from the board that they're comfortable for us to execute.
As you're going to be answering questions on all of them, we may as well go through them all, I think.
Okay,
Michelle,
I'll do a quick run. There may be questions. I know colleagues we have had some discussion around these previously as well. So colleagues have had the chance to ask some questions previously. So the second e-library then is evidence summaries. This is a slightly more stable in terms of the usage, so a longer term agreement. This is for 2 years with the option to extend for a further year if we wish to do so. Only 2 suppliers here. Those are BMA and Elsevier are the 2 suppliers. Again, we're using the NICE framework, which was established specifically for this purpose, so that's helpful for us. And it's the same team. So the library team also look after these services, and other members of the library service board. And again, this is a specific funding allocation and resources are set aside to manage this service. So seeking approval to execute those 2 agreements. They both start in January, and they would obviously provide continuity of service then for the future period.
Let's take those 2, shall we? Because
okay,
the similarity, if there's anyone's got any comments. Ruth.
Thank you, Michelle. It was just a comment, really. I know that we had some previous discussion prior to board on this. And one of the things that I had asked about was around our user research in this, because this is such a critical resource. And I was quite pleased to hear that we engage with the users really closely on these to make sure that we've got up-to-date resources and we've got access to all of the current information. So I just wanted to note that there, because I think it's a really important part of these services for us as a learning organisation and for the rest of the wider system.
Yeah, I think that's really helpful. Thank you, Ruth, because it's quite an expensive resource if you look at the contract values, but it is a very wide base. And you're right, the team do an awful lot of work with users. I think when we had the discussions, didn't we, and the head of the service was pointing out to us that some of these are procured because they have a very wide user base. Some of them actually have quite a niche user base, but they're used specifically to inform particular aspects of care. So both important in that respect, but that is a constant review process. And we also look at satisfaction, really, as well as usage. So yeah, and we will make sure that we continue to do that, because it is quite a big investment, I think, for in these services. Yeah.
Ridgeon wants to come in, but just before you do, Ridgeon, I mean, the contract values are so different. Is that largely related to just the volume of journals coming through each contract, or the volume of evidence summaries coming through the 2 different?
Yeah, the challenge that we have is particular resources are only available from specific suppliers. Publishers have certain rights for some rather than others. So it's a bit of a mixed bag. So we compete as far as we can. And as I say, we use the NICE framework because it's been established, with that particular market and our particular usage in mind.
Yeah, and some of the niche journals are fearsomely eye-wateringly expensive as well, aren't they? But Ridgeon, you want to come in?
Yes, Chair, I was going to actually come in there. I mean, if I look at my own experience, I have the British Journal of Urology, I have the European Journal of Urology, I have the American Journal of Urology, and I have urology. And a normal clinician would not be able to subscribe. In fact, wouldn't want to subscribe to all of those because it's actually not possible to keep up with all that information coming in from all of those places. My second point would be, I'm very proud of the library team. They're a very small, dedicated team that manage a large budget for some very important information, which supports evidence-based delivery of care. And that's the key message here: evidence-based delivery care. And we as a learning and an innovative and organization that are going to move into the more into publishing research from some of the stuff that we're doing, I think we will find that team is absolutely key in the delivery of these things. Our relationship with the stakeholders, and what I'm particularly want to point out, is the actual users of these services. We've done our best to enable easier access. So previously there was something that people may be familiar with called Athens login. Actually, we've made it a lot simpler now. We've used the National Active Directory for all our NHS users. That's essentially the key entry point that they use every day to get into computers every day to sign off results. And we've enabled that with our suppliers to make sure that they can get into the evidence-based journals without having to remember yet another password. And I think that's been a very well-received improvement.
Thank you, Ridgeon. I'd echo those comments about the importance of library services, who are often unsung heroes in the in many systems. Any other comments So people happy to approve those two procurements? Okay, if we take the other two together, then Michelle,
I will. Thank you, Chair. I was just going to say, just to be very clear on those two, and perhaps just a reminder to colleagues, any contracts that we're seeking to award over a value of £1 million, we actually send a notification to Welsh Government, and Welsh Government, they note our notification, so they don't approve the award as such, but they do note that that's our intention to execute. We haven't received a response from Welsh Government on those two yet. We have submitted the notification to them, so we wouldn't actually we wouldn't execute the agreements until we've received that notification. I'm expecting it in the next couple of days. So once we've received that, I will confirm that to the Chair, and then we can move forward with the execution. And we've got a bit of time there to the 1st of January. So for the next two I'm going to talk about, we have received receipt of notification from Welsh Government, so we are at liberty to proceed. And there's some details I just need to share on those. So the next two really relate to our infrastructure, and in particular our support around WPAS. So the first is for Citrix licenses. So these are used to provision, actually in addition to WPAS, a number of our national services are delivered using Citrix. So we've also got the laboratory system and hospital pharmacy also deployed using Citrix. We are proposing to enter into a contract for a 3-year period. We've got an option for a further year. I think the key thing here, and it links to the conversation we were having earlier and Claire's update on cloud, is we've procured these licenses in such a way that they will support our transition to cloud. So these services are currently run on premise, but at some point, as we work through our plan, we will want to transition to cloud hosting. The nature of the agreement that we're entering into now would facilitate that transition. So it was helpful for board members to understand that. We've run a competitive procurement and a national procurement service framework. So these are frameworks in Wales for the public sector. And we're proposing to award to Computer Centre at a value of about £1.5 million for the 3-year period. So this is obviously an in-house requirement. So the requirements have been defined by teams in-house and signed off by Carwyn as our Director of ICT, and funding has been confirmed through Claire in terms of these licenses. So we're seeking approval to execute that agreement. It also starts in January next year. And then the other one is some hardware that we run the WPAS system on. So this is currently in a position where the hardware is legacy hardware, and we need to refresh that in order to maintain performance and service as we go forward. So we've run a procurement again using the National Procurement Services Framework, and we are proposing to award a contract to Dell. Ostensibly, this would be a call-off of hardware initially and support. We've got a sort of 2-stage call-off that I've set out in the detail of the paper. That one is just under £1 million in investment value. See, the point I do need to be very clear about here is that we are seeking additional funding for this from Welsh Government. So we have put in a submission through Claire's team to Welsh Government, and we are currently waiting for formal confirmation. So I understand, Claire, you may want to comment, but we've had informal confirmation, if you like, that funding should be made available to us. We have not received the formal confirmation yet. So again, unless and until we receive that confirmation, obviously we need the funding to proceed. So if the board is comfortable to note your approval to proceed, then we would wait, and again Claire would confirm that when that funding is received, and then we would move forward to execute.
So it would be done then with subject to the approval here, and then on chair's actions, would it? And then that ratified. But yeah, okay. Claire, did you want to pick up on the money at all, or?
Yeah, so this would ordinarily form part of our discretionary funding for next year, because it's a central infrastructure spend. We've had conversations with Welsh Government to find out if there is additional capital available this year that we could then allocate to this and bring it forward. We were encouraged to go out and do the procurement, and we've had verbal but not written confirmation that this would be funded by Welsh Government this financial year. So I think it's a matter of course that they will do the confirmation. And once we have that, then at that point we would place the order.
Any questions or comments? Okay, thank you. And well, obviously people happy to approve those two procurements with the proviso that Michelle and Claire have just pointed out. Great. Okay, so we're running nicely to time. We'll take a 10-minute break now, folks. So it's now 5 to midday, back at 5 past midday. Thank you. Okay, well, we'll make a start on the final part of the agenda, the governance, risk, performance and assurance section, and start off with yourself, Michelle, the integrated organisational performance report. So over to you. Thank you, Chair.
Colleagues will have noticed there are two performance reports actually in the board papers today. So under items 6.1 and 6.2, I just wanted to put those into context really. I'm going to focus on the first one, which is our performance position for the last 2 months. So it's the September-October performance report that we usually consider at the board, and I want to just call out a couple of key points. The other report is a bit of a review of the last 6 months. So in that sense, the content should be reasonably familiar to colleagues because it's covering the kind of ground that we've been discussing as a board. So just in terms of context, so I'm not necessarily going to go through all the detail of the second one, otherwise we could find ourselves feeling like we're in some kind of deja vu situation. But when we come on to that, I'll explain why we've put that together. So in terms of the performance for the last 2 months, there are a couple of things I just wanted to call out. Obviously, there's quite a lot of detail in the report. Again, some big achievements, I think, in the last couple of months. So still working and still quite a focus on our support for COVID, but at the same time delivering other key benefits, I think. So just wanted to mention a couple of those. The GP advice, and I'm at the risk of sounding clinical, so Rydia may want to help me out, but what this is really doing is enabling GPs to get advice from secondary care clinicians. So where in the past they may have made a referral, which can potentially lead to delay and another step from an individual's perspective, now means that they can request advice from colleagues and, as I say, cut down on referrals and hopefully deliver care more directly. So that's a big improvement, I think, in terms of that functionality. I won't say anything about the electronic nursing care record because my colleagues did that fabulously already earlier, but that is continuing to roll out, and we talked about the forward plan on that, didn't we? I do want to call out the hospital pharmacy because another one, we are really proud of this project. It's been a real collective effort. I sit on the board, but that's probably my key role in terms of pharmacy, but we have a really good team in-house, and also a really effective team across Wales really, which has meant that we, from start to finish, we rolled out a new solution across Wales in 12 months, which I think is it's a really strong indication that it's possible. And actually there's a lot of lessons in that project, and we talked about that in our digital governance and safety committee, that there's lots of lessons I think that we need to kind of surface and think about how we share those more widely, because we really can move at pace when we want to. So the last site to go live is actually Ysbyty Gwynedd. They're due to go this week. They're on track to go this week, and that will be some 2,500 users then using that new system, replacing what was a very long in the tooth 25 to 30-year-old system previously. So really excellent piece of work, and I think rolling out into pharmacy, and at risk again of stating the obvious, pharmacists have been quite busy during COVID. They were certainly material to things like the vaccination programme, but they've been able to manage this as well, which I think is really helpful. We talked about the architecture work, and again Rob and Ian shared that whilst we're slightly behind where we'd hoped to be, because of resources, that we've made a significant amount of progress there, and really good engagement in terms of that. I was going to mention about cancer. I think we mentioned this is the replacement to the legacy cancer system. We did discuss that in a previous meeting, and the revised plan that's now been agreed. And the final one I was just going to mention was Bwrdd. So that's the new system into our emergency departments. So that's actually key in terms of supporting emergency care going forward. So we've had a change in order. That was through discussion and agreement with the health boards And we are now on track, and we had a meeting, in fact, with colleagues in Swansea Bay earlier in this week, really keen to go live now in Neath in their minor injuries unit by the end of this month. And then they will be the first site to roll out then into their major ED. So good progress, I think, in terms of those areas. One of the other key things I wanted to call out, and I'm going to bring in Carwyn, who actually leads on the service delivery here. We have noted in the report that there were 2 service incidents that have actually breached the service levels. And I wanted to ask Carwyn, perhaps if you could just come in and explain to board members, what was behind those really, and why that, why that has happened, because obviously that impacts on our service users. So Carwyn, if I could ask you to come in on that, and then I'll just come back and pick up on the workforce point.
Yeah, thank you. Diolch, Michelle. So yn gyffredinol, mae'r perfformiad gyda'r gwasanaethau gweithredol wedi bod yn dda. Yn ystod y 2 fis, fe wnaethon ni gael 6 digwyddiad sylweddol, hynny yw, lle mae 1 neu fwy o'n systemau ni ddim yn gweithio fel y dylen, a bod hynny yn effeithio ar nifer o bobl. So trwsio ni 4 allan o'r 6 yn gyflym iawn ymhell o fewn yr amser a ddisgwylir, ond nath 2 fynd dros y target. A dyma rai wedi Michelle yn sôn amdano. So mae'r 2 yma yn greu gyda'n cysylltiad ni gyda'r rhwydwaith. So y rhwydwaith sydd rhwng Cymru a Lloegr. So enw'r rhwydwaith yn Lloegr yw'r Health and Social Care Network, neu HSCN, fel byddwn ni'n galw fe'n fyr. A fel y byddwch chi'n disgwyl, mae gyda ni 2 gysylltiad i'r rhwydwaith yma o Gymru. A digwyddiad cyntaf, yr un ar yr 7th o Hydref, fe nath y cwmni sy'n rhedeg HSCN, sef BT, ddechrau danfon y traffig wrth fod i ysbyty Bai Abertawe a'r meddygon teulu ar draws Gymru i sefydliad arall sy'n cysylltu gyda'r HSCN. So nath y traffig ddim fynd lawr naill neu'r llall o'n cysylltiadau ni. Wedyn oherwydd hyn, wrth gwrs oedd ddim yn bosib i'r cyfrifiaduron yn y sefydliadau hynna, hynny yw Abertawe a'r meddygon teulu, i gysylltu gyda unrhyw systemau wydda'r rhwydwaith HSCN. So beth yn tîm ni i weithredu system sy'n cael ei galw'n Network Address Translation yn gyflym, a fe wnaeth hyn wella'r pethau i'r rhan fwyaf o'r defnyddwyr. Wedyn fi o'n i'n gweithio gyda BT a NHS Digital sydd yn gyfrifol am yr HSCN i gael nhw i gywiro'r sefyllfa. Ac fe wnaethon nhw o fewn rhai oriau. Ond yn anffodus, rhai diwrnodau yn hwyrach, nath BT ail greu'r un broblem, ond fe wnaethon nhw gywiro fe lot ynghynt. Felly mae'r amser sy'n cael ei adrodd y 3 diwrnod yw'r amser rhwng dechrau y broblem gyntaf a diwedd yr ail broblem. Wedyn yn symud ymlaen i'r ail un, roedd yr ail ddigwyddiad yn gysylltiedig gyda'r prosiect i newid o un cyflenwr i gyflenwr arall ar gyfer yn cysylltiad ni i'r rhwydwaith HSCN. Roedd yn contract ni gyda'r cyflenwr breiddiol wedi dod i ben, ac cafodd y gwaith i wneud dros nos. Ond roedd rhai defnyddwyr ddim yn gallu'r cysylltu gyda rhai gwasanaethau ar HSCN y bore canlynol. So fe wnaethon ni weithio gyda rheini i drwsio pethau. A mae'r amser ni'n dangos eto yr 1 diwrnod a 5 awr, yw'r amser rhwng y galwad cyntaf yn dod i mewn i'r ddesg gwasanaeth a'r galwad olaf yn cael ei drwsio. So ni'n gweithio gyda NHS Digital i ddod i wraidd y broblem gyntaf i wneud yn siŵr fod hyn ddim yn digwydd eto, achos gallai hwn digwydd effeithio unrhyw un sydd yn gysylltu ar rhwydwaith HSCN. So mae NHS Digital yn moyn dod i wraidd y broblem hefyd. So diolch yn fawr. Nôl to ti, Michelle.
Thank you, Carwyn. And if anyone's got any difficult technical questions, I'll bring Carwyn back in so you can ask him in terms of those. So thought it was helpful just to include those. You'll note generally the service levels have been high, but obviously when we do have a significant impact, then we're very mindful of the impact that it has on our user base. So the last thing I wanted to say again, and I said we would be probably discussing it a number of times today, was around workforce. So you'll note we're just under the target that we'd set for ourselves in terms of recruitment. We have actually said, and we kind of, our head of workforce was reminding me the other day, we have appointed into 197 posts in the period since April, which is actually quite a lot in recruitment terms. I think one of the challenges is slightly more than half of those are actually opportunities internally for people who've developed and moved up in their roles, which is really positive as an organisation in terms of the way that we're developing our folks. But it means that our net increase is somewhere around about 95 in terms of overall. So we're still continuing to work on that. And in fact, we've got a small team at a recruitment fair in Cardiff today. So we're spreading the net wide, and we continue to do so really. You know, working with agencies, we're going to recruitment fairs. We're looking at setting up an initiative with schools so that we can have, you know, with folks going out to schools to encourage individuals to make a career choice really around digital and around digital in health particularly. So we're continuing to develop those mechanisms. We are having you know, quite a degree of success, I think, in recruiting people into the organisation. And also, and I know we've talked about this before, and you've heard probably a couple of references you would have noted this morning, how we can work with commercial partners. So it's, you know, how we can, and other partners actually, it's not always commercial suppliers. And I think it's the reminder, isn't it, in our role as part of the NHS Wales in how we can support the wider community actually and create jobs, not necessarily in our own organisation, but more generally. So we work again with a range of organisations to be able to resource a little bit more creatively to deliver our requirements.
Thank you, Michelle and Cowan. Ridgeon wants to come in, and then I can see Marion wants to come in as well.
Yep.
Thank you, Chair. I just wanted to expand on the value of the GP advice, which is sort of underplayed in the 4 lines in this report. Just to make the board aware, this is all about timeliness referral for appropriate care in appropriate settings. And what we've been able to do is modify the strong foundations that we built with GPC services across Wales, which send in all their referrals with a single generic template, which contains a summary of the GP record, and allow us to accept a referral, to redirect a referral, to put a referral on hold pending investigation, or to return a referral with advice. The GPs now have a choice to ask directly for advice. This includes sending photography or sending an image, or they can, having made the diagnosis, request treatment. So in a clear cut, this requires X. They can make that recommendation, which means that patient's referral pathway can potentially be speeded up to the treatment X, or they can ask for investigate, where they've done some investigations in primary care, but may not have access to those more specialist investigations in secondary care. And once it went live, and I was fortunate to be in one of the units where it went live, we had a request for advice within the first hour. So obviously there was a need for it, and it was met by the users. And we had the opportunity to present this at the Planned Care Summit that was recently hosted and attended by the Minister. I held a workshop on this, extremely well received. And our initial findings, although it hasn't been going very long, is this has the potential to release 2 to 3% of outpatient capacity. Now, when we consider what we're up against in the recovery for COVID, this little change that's been done with our users could have quite an impact.
Yes, 2 to 3% of an enormous number is quite a big number, isn't it? So, Marion, and then Rowan.
Diolch, Cadeirydd. O'n i eisiau mynd yn ôl i'r...
Not hearing you very well. Oh, there we go, I'm sorry.
O'n i eisiau mynd yn ôl os gai, Michelle, ar gyfer eich adnodiad chi ar y gweithlu. Ac o'n i falch iawn o glywed bod yna gamau mor fras wedi digwydd. Ac da ni wedi bod yn llwyddiannus i recrwtio i gymaint o swyddi newydd mewn ffordd. Da hefyd clywed am y gwaith rhagweithiol sy'n digwydd, neu sy'n mynd i ddigwydd yn ysgolion hefyd. Oedd y cwestiwn o gen i, lle mae'r pwysau mwyaf o gofio bylchau sydd gyda ni? Lle mae'r bylchau yma? A lle mae'r risgiau mwyaf wedyn o ran yn gallu ni i gyflenwi'n gwasanaethau'n effeithiol.
Thank you, Marion. Yeah, no, it's a really good question, I think, and we've got a recruitment task force that we stood up really to be very focused in terms of, you know, our understanding of that and whether we're targeting the right things. The honest answer is probably we've had challenges in a number of areas. Probably our software development is one of the areas, because I think as we've grown particularly quickly in some of those areas. So we know, you know, where we stood up some of the TTP services, we were able to move really quickly. But what we're now trying to do is establish the team to embed that in the organisation and make sure we've got a sustainable support model. And in other areas, you know, we've had additional funding from, you know, the Digital Priorities Investment Fund, which is great, but it does create demand, and in the development areas, I think I would say particularly is probably the one where, and I think it's about quantity and about the level of people we're bringing in. I think they've, you know, and reflecting that, they've invested quite a lot in a program to bring people in through the system. So bringing in people perhaps that are school leaver, or perhaps, you know, apprentices, or you know, even graduates. And that directorate in particular, I think, has had a lot of focus in how they can, you know, it's basically developing in-house, isn't it? Developing our own, bringing them up through the system, as well as appointing at some of the more senior levels. I think probably if I look around our table, Claire and I would probably say, in terms of some of the SHA roles, in some of the particular niche roles in finance, and some of the you know, some of those roles, we've struggled a bit, I think, to attract enough candidates to fill those roles, or it's probably taken a bit longer than we'd hoped. I don't know if other colleagues wanted to comment on that in their own areas. Yeah, Claire, did you want to?
Yes.
Yeah,
thanks.
go on, Claire, if it's on this point, and then we'll come back to you, Rowan.
Okay, thanks. Yes, the way that I sort of the way I look at this then, Marion, is that if you look at our core deliverables, actually the organisation's grown as a result of the SHA, and Charles quite right. For those posts, it's at an exec level or at a specialist function level, such as commercial or financial, which are difficult and timely to recruit to. So I would say, from an organisational perspective, from a core operating perspective, those are the areas, those are the touch points to look at. From a COVID perspective, I think there is the challenge in terms of specific skills, in whether that be in architecture, and as you saw from the NDR and also from some of the presentations we had earlier, we've had to pull on those resources. Backfilling those resources is difficult. And then from the Digital Priorities Fund, there what we're seeing is quite a significant uplift as those schemes are being approved. And generally that's been later in the year than we would have anticipated. But within that, there are, again, some specialist skill sets that we're looking to develop, particularly within cyber, within design and development. And I think the challenge there is attracting those skills to DHCW in a very short time frame, and at the same time building that pipeline through the work that they're doing through Workforce. And the other challenge, I think, is having a comparable pay rate to enable those resources to be filled. So we're trying to balance that, I think, and supplement it where possible with some commercial strategies around working with Welsh suppliers to develop that skill within DHCW. So I think it's a really valid question, Marion. Thank you for that. But I think for the way I look at it is to look within the different segments as to where those touch points are, and for each of those we've got strategies to try and accelerate wherever we can.
Thanks, Claire. Carwyn, did you want to come in on this point?
Yes, please.
Sorry, Rowan, we'll get to you eventually.
Yeah, just very briefly, responding to Marian's question. So fi'n credu ni'n ffindio bod ni'n cael problemau yn y meysydd mwyaf le mae'r technoleg mwyaf diweddar hefyd, a le mae fwy o alw yn gyffredinol ar draws y wlad neu ar draws y byd. So mae pethau fel diogelwch cyber yn un ohonyn nhw, cyfrifiadur a'r cwmwl yn un arall, a fi'n credu byddwn ni'n cael yr un fath o broblem gyda pethau fel Microsoft 365 ac yn y blaen hefyd. So ni'n gweithio gyda partneriaid bod ni'n gallu cael contractors neu beth bynnag unigolion cwmniodd mewn I helpu ni le mae angen I ni, a le byddwn ni'n ffindio fe'n anoddach I recrwtio'r bobl yma, a hefyd I ddatblygu y staff sydd gyda ni hefyd I gallu symud mewn I rei o'r meysydd yma. Diolch.
Thank you, Carwyn. Rowan.
Thank you, Simon. I've got a question for Carwyn. Carwyn, I sort of have some sympathy for you in being the person who has to talk about occasionally when the systems don't perform within our specifications. And you've spoken earlier in the board about the need to maintain and keep our existing systems up and running. As we move into the IMTP, can you talk to the board a little bit about some of the challenges we face in making the case for investment in existing systems rather than investing in the new shiny things? And perhaps does that create a tension in achieving some of the service levels that we're being asked to deliver on behalf of the wider NHS?
Yeah, of course. So I think we've made really good progress over the last couple of years in terms of modernizing some of our legacy infrastructure, and we are getting there, and but we still have quite a lot of technical debt, where we are still at the moment being pushed by the tail end of the technology curve and things falling off the end rather than being at the leading edge and wanting to be, right at the sort of that more closer to the forefront. Yeah, it is challenging. We have a number of things that were invested in with sort of one-off funding several years ago that are now becoming old. And I think the number of systems that we've got and the dependency and the usage of the systems has grown so much over the last few years. And the size of the teams that support them haven't grown with those, as in we've had funding and additional funding for additional resources to do new things. We have had some growth, don't get me wrong, as in myself and Claire have worked closely on recruiting people, at financial risk into the organization. We're looking at underspends in other departments and so on and so forth. But we are looking to try and put that right through a number of things that we're doing now, like the Microsoft 365 Center of Excellence, the cloud business case, is trying to make sure that we are shoring up the number of people that we need to do that maintenance. But it's just there are a lot of things that are going old all at the same time at the moment. So yeah, and in terms of planning, we've talked, I think, a little bit earlier on about what we've been doing with that. So we met last week, as in with, as spawned by my teams going, I haven't got any capacity to do all these new things. And then we go, right, well, what's the priority then? As in, let's talk about it. Well, let's decide where we might be prepared to take some elements of risk, where we're not prepared to. And I think one of the things that we're working on at the moment is splitting out, because we have a number of positions that have been funded in these different teams from sort of project-specific budgets. So they might be funded by NDR or cancer or whatever, and it sometimes makes the teams look reasonably big, but of course they're not, because those people are working on those very specific things. The core funding that we've got for some of the teams is quite limited, and so we're now working out what capacity we have when you take off annual leave, training, all the other bits and pieces, and then working out how many of those business as usual replacement things we can do, and then what balance we've got to work on the newer things.
Thank you, David. Did you want to come in on this point? I know Claire does, but is it a different point, David, or?
I wanted to go back to the resource point, Simon, so I'll hold my question for a minute.
Claire, do you want to come in on this one?
Yeah, so I think to answer your question, Rowan, we are addressing our technical debt, and as Carwyn's highlighted, we've made significant progress moving to the new data centre in tackling some of those key issues. We've still got issues to address, and we are taking every opportunity to accelerate that where we can. And I think the W Powers investment we all approved is an example of that. And as Cowan has suggested, we are really ensuring that we managed our capacity and maintaining those core systems, and then starting to think far more strategically in terms of, okay, the key issue for us then isn't the infrastructure, it's the growth rate. Yeah, and people can understand that because you've got your foundations in order, then it's about the growth rate. And for us, from an infrastructural perspective, that's really aligned to our cloud strategy and how we move into a different dimension where our focus is more on development and delivery and less on the infrastructural management process. So I think we're in a bit of a position whereby we're reforecasting as part of our IMTP our capital requirement, for example, for the next couple of years. And that is now in a far more manageable, I'm looking at Cowan, you might disagree, but a far more manageable portfolio than it previously had been, which is good. And now really our emphasis shifts to stabilising that. And you'll see in the financial presentation a bit later on that, as Cowan alluded to, there is a couple of pinch points within his organisational structure that we've managed financially this year. What we're trying to do is put strategies in place to stabilise and realign that so that we get into a far more sustainable and a far stronger position. And I genuinely think that we've certainly made some big steps. We've still got quite a lot to go, but by being able to visualize that, people can understand that and they're far more supportive.
Glad, David.
Thanks, Chair. I just wanted to follow up the question that Marion asked and Michelle's response, which was around the difficulty of attracting software engineers. One of the things we've spoken about previously was trying to identify local suppliers that we might be able to offload packages of work to. I just wonder if we identified anybody suitable and whether that was an avenue for helping.
Do you want to pick up on someone who can pick up on that one?
I'm happy to.
Claire, did you put your hand up or?
Yeah, if you want to. So yes, in answer to your question, David, we are, and if you look at our strategic procurements going forward, you'll see that we are proposing to engage with local suppliers in the provision of additional services and support. Sorry, Michelle, I don't know when I wanted to talk to you, but I was quicker than you in terms of.
I couldn't find my mute button. But
great. Michelle, did you want to just wrap up on this section because we need to move on, I think now.
Yeah, just to agree with what Claire was saying, it's an ongoing task, isn't it, to be honest, David? So we've got some in specific areas, targeted areas where we're working with partners. Some of those are already on board, some of them moving forward. We've then got our dynamic purchasing system, which actually allows us to call off resource a bit more flexibly to support particular developments, as you've touched on there. We are really trying to focus that within Wales wherever possible, so supporting the local economy as well. And there are other benefits, I think, to working closely, aren't there, with development teams. So we've got a mix of those, and we'll continue to work in that way, I think, and that will be something that we'll be now looking at in terms of the development of the IMTP for next year as well. So it's an ongoing piece of work, I think, really, to think in relation to every bit of work that we're doing. Should we be doing that in-house? Should we be trying to recruit in-house? Or actually, is there something available in the market which could be more effective or more efficient in terms of taking that forward? So it's a balance, I think.
Ridian, do you want to come into briefly?
Very quickly, it was just to say, for me, there's Digital Healthcare Wales, there's the wider NHS, because there are more developers across the NHS than there are within Digital Healthcare Wales, and we've already got examples. You've seen one today, Welsh nursing care record as a collaborative approach. Yes, we have got commercial, think of them as sort of coding factories, David, that we can call off. One of the issues that we do have, though, is the defining of the user requirements, so that presenting a package that can be given to a commercial supplier who may not have the understanding of the complexity and the pathways within the NHS. So that is one of the issues that we have. We have to be confident that the thing that we're asking for them to build is actually the thing we want them to be built. And we try and do this in an agile way, but access to the users to get that frequent feedback on the progress and development is a bit harder with a commercial supplier than it is with an in-house.
Thank you, Rudian. If we move on, Michelle, just to give you a heads up, Michelle, as well, and I'll come back to it at the end of this section, we did miss out 5.2 Roman numeral 5, and I'm sure we need to formally approve the strategic procurement plan. So we'll just pick that up right at the end of this section. Okay, over to you again, Michelle.
Thank you, Chair. I can do that quickly. So that was our kind of performance the last 2-month period. I just wanted to fairly briefly mention then paper 6.2, which is our sort of 6-month review of performance against plan, really. So again, hopefully familiar to colleagues. You'll see that it's presented against the portfolios to make a bit more sense in terms of the plan and what we were seeking to achieve. This will also be shared with Welsh Government. So this is something that Welsh Government are keen to understand. All of the health bodies and trusts will be doing a similar exercise now. So as I said, I wasn't necessarily going to drill into the detail because I think these should be things that we've discussed previously, but happy to take questions. And the other thing for people who've really all over their papers, you will notice the minimum data set is also included with that paper. So that's the nice spreadsheet at the back. You may have noted when you looked at that, that lots of those things don't really seem that relevant to our operation. Again, because that's completed by all of the organisations across NHS Wales. So some of the factors really aren't key to us. And the reason that's in the set is because we've been asked to update purely in relation to workforce. So there's also clearly financial data in there. The finance team provide regular updates to Welsh Government and have been through a number of reviews. So that if we were not asked to update the financial information in this form specifically, we were asked to specifically look at our workforce and in particular any anticipated COVID impact on our workforce. And again, I think that's fair to say that's probably more of an impact for the health boards and trusts than it is for us in delivery terms. So just wanted to check that colleagues are comfortable with that and take any questions on that.
Let's say any questions, and if not, are colleagues comfortable? It looks, go on then, Rowan.
Michelle and possibly Claire, it's just a question. You know, we have a couple of projects in our portfolio, and we all understand why they're red, because people have been prioritised onto COVID, which is absolutely right. What does that mean for the funding allocation that we receive for Welsh Government for those projects? Has that been will that be carried over, or how does that work as someone who's naive to NHS funding streams?
So I'll take that one. So there's a couple of things, and I'll highlight it in my financial report later. So as part of the half-year review, we've had a detailed review with Welsh Government, and they instigated a detailed review of all the digital priorities investment funding and their next 6 months funding review. And what that did was then look at their plans and the funding allocations, and both the COVID and the DPIF funding arrangements are a pay-as-you-go. So if you don't do it, the money goes back. Yeah, and for programmes that within the DPIF, that's rescheduled then into later years, generally speaking, unless the project comes to an end. So, so we've been through that process, and you'll see in the financial report, actually, a lot of the capital and revenue has been rebased. And in the case of COVID, we gave that money back. So that's how the financials link to that. They are secondary to our core funding, which is obviously which is quite separate from that.
Thank you, Claire. If there's no other comment, then I'll thank you for those 2 reports, and we'll give you a breather, Michelle. And hand over to Chris, who's going to take us through the risk management report. Over to you, Chris.
Thank you, Chair. In terms of the risk management report, I want to just talk through 3 sections. So just starting with some international context, then talk through the current risk register and our risk profile as an organisation, and then finally talk through the risk appetite statement and look for board approval on that. So in the main body of the report, there's a section included on the World Economic Forum long-term global risk landscape. This has been updated for 2021. And there's just a couple of things I wanted to pick out for our context. And to be aware, as a group of directors, myself and Claire are arranging a session on this governance and regulatory framework to get into a bit of detail around it. But the underlying disparities, so the damage from COVID-19 and access to healthcare, education and technology, social fragmentations is highlighted in terms of public health gaps and digital inequality, and narrowing pathways, so the number of people without access to digital tools or is at risk of increasing. Now, I know this is international context, but I think it's helpful for us as an organisation to be aware of that. So moving on to our corporate risk register and our current risk position, there's 19 risks on our corporate risk register. These are included as item 6.3 II or Appendix B. 5 of these risks are marked as critical, 14 significant. 4 of the risks are private due to the sensitive nature, and they'll be discussed at the private session of the board later on today. In terms of changes since the last board meeting, there's been one risk that's been escalated and approved by Claire as the lead director for that risk around public sector pay policy. So that's come on to the risk register. There's been one risk that has been downgraded since the last time we met as a board, which is the shielded patient list, which was approved by Rachel, and that's been discussed at the Digital Governance and Safety Committee. So just looking at the heat map, as per our last board meeting, CANISC remains our highest risk on our risk register. And there's just a couple of things I wanted to flag. So the risks assigned to the Audit and Assurance Committee were reviewed on the 5th of October, and those assigned to the Digital Governance and Safety Committee reviewed on the 15th of November. There's one risk in particular that was discussed at the Digital Governance and Safety Committee around the switching service that I know we were planning to come back to in the context of the NDR discussion. And since that committee meeting, David has reached out just to confirm next steps and when and how we'll be discussing that in a bit more detail. So I'd like to have an action recorded from today that I will meet with David, Rachel and Becca to go through that and then feed that back through that committee and this board. So if that can just be recorded. David, I don't know if you want to come in on that point.
No, thanks, Chris, for raising it. And no, I'm happy with the action to follow up in a few weeks, hopefully.
Okay. So in terms of the corporate risk register, I'm asking the board to note the current position and the changes in risk scores. I'm going to pause for any questions and then I'll move on to the risk appetite section.
Yep, thank you. And it's probably worth just for the record explaining that the nature of the risks that are sensitive is because of the issue rather than because of for anything that we would in any way not want to discuss in public. I mean, I think it's important that is people are aware that is the case. Ruth, you've got your hand up.
Just as a follow-up to what you said there about discussing the risks in private, Simon, it's something that we challenge. I know we challenge at Risk and Assurance, and we challenge, I believe, at Digital Governance as well. Whenever these risks come before us, the question we always ask is, what can we actually hear in public? So we challenge ourselves and we challenge the team to do that, because the drive for all of us, and I see Sian's nodding because I know she's done this in her committee, is to hear as much in public as we possibly can. So I think it's just worth noting that every time we have a private discussion, the first question that we ask is, does this really have to be private? Does it all have to be private? What's the risk? Because actually we should be doing as much business in the open as possible. So I thought it was just worth reiterating that point.
Thank you, Ruth. Anyone else got any questions or comments for Chris before we ask him to go into the next section? Okay, so that's been that risk register and those changes have been noted, and Chris, so crack on.
Thanks, Simon. And just to come back on Ruth's point there, we have had some really helpful discussions with colleagues from Audit Wales and Internal Audit about that exact point, and making sure we are doing everything we can to, in terms of what we can take in public. Okay, so moving on to the risk appetite work, the board will note in the pack the risk management and BAF milestone or board assurance framework milestone plan as Appendix C, and this highlights that we've had 4 sessions, I think, as a board since our establishment through from July to the most recent one on the 4th of November, where we've looked at risk board assurance and started to develop our risk appetite. So board members will recall from these sessions that risk appetite is the level of risk that an organisation is prepared to accept in pursuing its objectives, and is obviously a key role of the board to agree its risk appetite and to discuss its desire for future risk appetite. So what's presented within the pack is the outcome of this work. So I'm just going to talk through 6.3 IV or 4 in terms of where we've got to with our risk appetite statement, risk tolerances, and the various risk domains that we've developed. So I'm just going to start by emphasising what's presented is our current risk appetite of the organisation. So the risk appetite statement we did some work on the 2nd of September and followed it up. It talks through the fact that as an organisation we must take risks to achieve our strategic aims and deliver benefits and outcomes to stakeholders. But it also caveats that, I guess, to some extent, that risks will be taken in a considered and controlled manner, and exposure to risk will be kept to a level of impact deemed acceptable to the board. And it's that I want to focus on, what's acceptable to the board. So within the packs, board members will see the definitions of the approaches from adverse to open, and the portfolio tolerances table that indicates that. So the risk domains indicate the risk rating or score in order for the risk to be escalated to the lead director for consideration of including on the corporate risk register. So where we're saying we have an adverse approach to a risk, a lower risk score would mean it's considered by a director. If we have an open or a hungry risk appetite for a domain, we would consider the risk a much higher risk score. So in practical terms, if we're open, we're not going to be cited on risks that are below a score of 20 because we're happy to accept those risks as a board. In terms of the risk domains, they're listed in the tables from finance, compliance, patient, citizen safety. I won't go through them all, but they're there listed. As one would expect, the level of risk appetite assigned to each of the domains differs, obviously, and this is based on the nature of the work that we undertake and the objectives we're pursuing. So I'm just going to pick out where we've scored ourselves, if you like, in terms of risk appetite. So patient, citizen safety, information storing and maintenance, and compliance, we've identified as having an adverse risk appetite. So this means we won't accept high risks in relation to these areas. So patient safety being things that impact on the safety and well-being of patients and citizens, compliance being things that impact on the organisation's conformance with legal obligations, statutory and regulatory requirements, and information storing and maintenance impacts on the ability to safely store, maintain data. So this is in contrast, our adverse approach to these areas to a number of other domains. So I'll just pick out a few. Corporate social responsibility, we've identified of having a moderate risk appetite. So this is our ability as an organisation to deliver inclusive, sustainable and socially responsible contribution to Wales. So when we think back to that international context from the World Economic Forum, things like digital inequalities, etc., fall into this category where we have a slightly higher risk appetite, but halfway, if you like, on the scale. Where we've got our highest risk tolerance is in development of services. So we're describing ourselves as having an open risk appetite for development of new services and our ability to innovate, I guess, in the discovery phase of developing services. Again, this risk appetite when services become live, so service delivery, this domain moves into a cautious approach. So I'm asking board members to note where we've got to in terms of it reflecting us as a point in time as we are now. And in terms of that point in time, I think it's just worth noting that we are a new organisation. We are growing rapidly in terms of staff joining the organisation, and therefore the culture is being shaped as we go along. I think the risk appetite probably also reflects where we've been in terms of responding to COVID, some of the controls we've had to have in place to deal with some of those pressures and moving resources around. As a board, when we discussed this on the 4th of November, I think there were a number of domains where we identified a desire to move to a more hungry approach in terms of risk. I think staff safety and well-being in the context of promoting empowerment as an organisation as we grow and develop was one area. Reputational risk, I think we agreed we needed to build trust and confidence with stakeholders, but then could look to take more risks that might impact on our reputation. And corporate social responsibility, and whether we can push the boundaries from a moderate risk appetite more to an open or hungry position. So the outcome of the work is there in the packs. I'm asking for the board to approve the current risk appetite position and agree to review this moving forward over the next 6 to 12 months and comment on any desired future risk appetite. So I'll pause there for questions.
Thank you. Thank you, Chris. Helen, and then Ruth.
Yeah, I just wanted to add to Chris's summary of that, really, that it's been a really kind of helpful exercise for us to work through. I mean, there's been a lot of work to get to this summary from all involved in the board today and others actually across kind of the organisation, and to thank Chris for leading us in this. And actually, I think it's quite an achievement for us to have been able to describe our risk appetite in the way that we have, and to actually set kind of those parameters in a very objective and transparent way for the wider organisation, actually, in the way that we're assessing the risk level for the organisation. So yeah, I think it's just really to share that actually the level of kind of discussion and work that's gone into actually arriving at the appetites and the actual domains as well, in terms of testing our thinking and how that actually, you know, how that works for us in practice in terms of the risks that present themselves to us as an organisation. So yeah, I fully kind of support where we've got to and the work that's been done. So thank you.
Absolutely, Helen. Ruth.
Thank you. I mean, I'd echo Helen's comments around the work that Chris has done to get us this far. There have been lots of discussions that have gone on about this, and it is a great achievement for a new organisation to have that amount of work done in the first 6 months. It's worth saying that those discussions haven't meant we all agree, because I have some fundamental disagreements with our stated risk appetite. I feel it's incredibly negative and is not the risk appetite of an organisation that wants to promote innovation. So the piece that is missing from this, it's disappointing that this is where we think we are now, but the piece that's really missing for me is, where do we want to get to? And if I think back to Chris's initial comments about the World Economic Forum underlying risks, if we think about underlying disparities, societal fragmentation, narrowing pathways, none of those risks have ever been solved by taking a cautious approach to things. And so my challenge to us as a board now is that we don't just sign up to this as our risk appetite, because that doesn't enable me as a board member to push and challenge the organisation as we go forwards. What we need to know is, where are we trying to get to? Because if I think about how will we deliver our objectives, what will be a risk to our objectives in 2 to 3 years' time, a negative risk appetite is a big risk to our objectives, because it means that we will only ever take ultra safe options. We won't try to do things differently. We can't deliver things at pace. So I think it's just worth putting on record that, you know, our discussions have been real discussions, and we don't always all agree on this, as my colleagues are lining up to tell me. So yeah, I know Chris probably wants to come back on that, because I have challenged him on this and we've had some good discussions on this as well. So I will end rant there. Thank you.
Yeah, I think there's 2 elements to what you're saying. It is where we are now, and where we might want to be. But then I can guarantee that at least Rydian is going to talk about certain aspects of activity within the health service that you can't be anything other than very cautious in terms of risk. But Helen was first, then Rydian, then Chris, then Rowan. And then we do need to move on, but we do need to work this through. Go on, Helen.
No, that's fine. And hearing what Ruth is saying on the the legitimate challenge to that, and actually we had the very same challenges in all of the discussions that we've had in actually consolidating all of our views into the stated risk appetite that we've got. But actually, I suppose the challenge that I would put back is we are open in terms of the development of new services. We're cautious and adverse when it comes to, I'm sure Rydian will come in, when we talk about safety and the aspects and the data aspects in terms of actually how we ensure that we have got safe use and storage of data, but that we are, as an organisation, we want, and as an NHS, actually want to be able to share data to the best effect. We need to make sure that we do that in a safe way. But I would kind of reinforce the fact that we are open in terms of our risk appetite, in terms of the development of new services. But there are core things that we really have to make sure that we have the controls and the safety mechanisms and frameworks in place to make sure that we are doing what we need to do and discharging our responsibilities and our accountabilities as a statutory organisation.
Rydian.
Thank you, Chair, and thank you, Ruth, for the challenge, because this is an important area, and it is something that has always troubled the medical fraternity. If I look back over my career, when I started taking gallbladders out, we used to do them through a big incision, all right, and you used to be in hospital for 5 or 6 days. When I finished my surgical career, we were taking them out through 3 little holes using a telescope and a camera. And when it first came out, that was considered extremely high risk. Now it's considered the norm. So there are some areas of medicine, and medicine is actually all about risk management. So to come to the digital element of it, we deliver and support the delivery of care through digital enablement of systems that have a massive dependency, i.e. they must always be on, they must always be available, otherwise people come to harm. So our risk management to infrastructure, to movement of data has to be low because of the dependency on it. We in Wales, I can proudly say, have got a information governance approach, which is very open in terms of using information governance for the positive delivery of care, as opposed to some cultures where information governance is used to a blockage to share care. And my final point would be, we can innovate in areas where we don't have a dependency on PII. And in fact, we can adopt a commercial approach of fail fast. But anything that has direct patient care, we have to consider what failure fast means. And you probably expect this response from me, Ruth, but I just wanted to highlight to the board that there are some balances, pros and cons, and some dependencies.
Chris.
Yeah, I think the points have probably been made. I think the healthy challenge, welcome, and we've had some good discussions, myself and Ruth, on this, which has been really helpful. I think the importance of the distinction between the domains is really important. I think it's a point Helen made in terms of where we are willing to take risk and where we're not. You know, we support national IT systems and infrastructure where taking risks can be, you know, have significant consequences, and we have to be aware of that. So I think it's just being clear on where we want to push our risk appetite and which domains they relate to.
Rowan. Where have you gone?
Thank you, Simon. I just wanted to say that I absolutely support Ruth's challenge. I think it's very fair that we have ambition and that we regularly review this risk piece. And Ruth, I'm right with you in making sure and taking on the fact that we do continue to revisit it. I also think that the points around patient safety, information governance is so critical. I mean, I think we've seen many examples, not just in the UK, but more widely, where patients lose confidence in how data is being used, and that that moves us away from a position that we can innovate from in terms of delivering digital. So it's a balance. And I also would reflect, I had the opportunity to do my 10 talk yesterday and talked about some of the things I've done over my career. And yeah, we have quite a lot of work to do in standing up the organisation and getting our systems to a level of robustness, to Rydian's point, that these systems do have to be always on, because the more we build into our clinical care delivery activity across the wider NHS, a reliance on the digital systems, then actually a system going down, you know, for half a day has a significant impact on our GP's ability. So I'm just thinking of what happened recently this month. You know, for that day, they're under pressure. They're we're in a pandemic. You know, our digital services need to be additional to the capability for our clinicians to deliver care. So I think this is right for now. But Ruth, I'm in your camp, and I'm going to be, you know, poking the board metaphorically with a stick to keep us honest. Is all I would say.
Carwyn and then Ruth, and then we do need to move on.
Yeah, I just wanted to kind of explain that, you know, that we've discussed this a lot as directors, and I think also just as the wider board as well, you know, as in terms of the messaging about this when we present it to our staff, you know what I mean, as in this does not, even though these things are all true, this does not equate to do things slowly, you know what I mean, as in, and it's how we get that message right, you know what I mean, as in I think as it is, it'll help us focus where we spend our money and things, you know, where we have some discretion around that capital revenue, you know what I mean, as in it'll help us focus that. But we are really keen to try and make sure that the staff understand that it's about managing risk and dealing with it rather than you know, going slow on everything because we've got a low or a cautious risk appetite. So I just
thank you, Karen. Ruth.
Thanks, Simon, and thanks everybody for your comments. I guess the final thing I would say is having an open appetite towards risk doesn't mean operating without controls. It means that you devolve your decision making across the organisation. And I think for me, one of the biggest risks that we face as an organisation, and we've seen that in terms of some of the key vacancies we've got across our exec team, is that if you have all of the decision making at the top of the organisation, it becomes very top down, and you're not an organisation that trusts its people to make decisions around your risk controls. So for me, you know, a healthy organisation is one where we move on our risk appetite. So you know, I'm looking forward to the next set of discussions on that.
Okay, it was a very helpful and fruitful discussion, and I mean, my simple mind sees it as we need to be as open with our risk as possible when we're innovating, but as soon as we then apply that innovation to, as Rydian pointed out, to patients, then risk changes entirely. It was just going through my mind. I mean, just take the e-prescribing. We might want to take lots of risks around how we innovate in there, but we certainly don't want to put a system out that has the potential to double the dose from GP to chemist through the system. So there's that patient safety, patient risk bit is a hugely important element in all healthcare services. We do need to formally approve this, don't we, Chris? So with the caveat of that discussion around this is not something that sits on a shelf, or this is very much a live beast that we will want to return to, and I'm sure there are people around the table who will make sure we return to it regularly in the context of of the organisation moving on. Are people happy to approve where we are at the moment? Don't worry, Ruth, I use the word happy advisedly. Okay, thank you very much, Chris. If we move, that's you finished now, I think, isn't it, Chris?
It is on this one, yeah.
Okay, then the finance report, Claire.
Thank you, Chair. So this is the financial report as at the end of October. I'll talk you through the main highlights and take questions at the end. So the part one just really re-emphasises the requirements and our current performance in relation to the financial performance. And compliance with statutory obligations really is that we operate within our revenue and capital limits, that we implement the payment policy, and we are effective and efficient in our cash management. Further along in the report, you'll see that we have achieved all our current financial targets. We are currently 595k underspend in terms of revenue at the end of October. We are 510 underspent in terms of capital, and our payment policy was at 97% at the end of October. Our cash position has fallen, so it's reduced to 3.1 million at the end of October. And together with Welsh Government, we are really monitoring the most effective level of that cash going forward. Given the level of national contracts we've got, and we saw some of those earlier, we think that this level is probably within the comfort zone in terms to ensure that we've got sufficient cash resources. So since our last report, and as I alluded to earlier in the conversation with Rowan, we have had a detailed Welsh Government and Financial Delivery Unit review in relation to our half-year position and our forecast position for the end of the year. And they've reviewed our run rates, and they also reviewed the COVID and the digital priorities investment spend. And that's helped to inform our future funding projections for the second half year. In relation to our core funding, as you're aware, we had a 3% pay award agreed, and this was not part of our core funding allocation. So during the month, we were allocated just over £800,000 to support that additional pay review. In relation to COVID, and I'll come on to it later, we have reallocated revenue of 7.2 million for the second half year and a small amount of capital of 300,000. And in relation to DPIF, there was an adjustment of 1.2 million revenue and 400,000 capital. And this really relates to the query we had from Rowan earlier in terms of the rephasing and the reprofiling of programmes as they progress. We also highlighted the opportunity to bring forward the WPAS infrastructure requirement, which would be an additional 1.1 million capital requirement for DHCW for this financial year. And as I've already alluded to, Welsh Government were very supportive of that, and we're awaiting final confirmation, which will enable us to action that going forward. The second section then goes into a bit more detail in relation to the financial position. So from a revenue perspective, we highlighted that we were 595 underspent, but we also projected an end of year underspend of approximately 350,000, reflecting the conversations we've had in terms of the recruitment rates in which we've been working on in relation to the SHA, but equally some of the pressure points we've seen within the ICT or the Information Communication Technology team in relation particularly to our data storage cost pressures. The section then goes on to talk about the capital budget. Our capital budget for this year is 13.4 million. And to date, we've spent 3.8 million with a remainder of 9.7 million to spend. Really, this reflects our new forecast in relation to the COVID and DPIF spend, and there's some minor changes there. In relation to our revenue, again, it details the changes to our DPIF in a bit more detail. And as you can see, the main movements in that have been the WCCIS reprofiling and the NDR. And in relation to COVID, this is the significant changes within TTP and the vaccine. The TTP changes were 3.3 million and the vaccine was 3.9 million. And these really are detailed in the graphs below, which show the licensing changes and the volumes of text and letter costs and changes as a result of our reforecasting. Again, that shows really as we've gone into a more stable position in some of the TTP activities, but also understanding our operational needs, we've made some significant commercial arrangements and efficiencies that have delivered that change. That said, there are, again, some areas of slippage in relation to our recruitment. But again, we've been looking hard at all the aspects in terms of tackling that. Our savings target for this year was 1.9 million, and we will deliver that, albeit 800,000 of that is recurrent, leaving a balance of 1.1 million non-recurrent savings that we will carry forward. We highlighted a risk, and it was also, Chris mentioned it in the last section, around the payment policy percentage. And this really reflects issues that we were experiencing in October in relation to scanning services that enable us to scan and invoice our invoices in a timely manner in order to comply with that percentage requirement of 95%. We are tracking that with shared services. They've now instigated improvements to their scanning facility. At the same time, they were going through an Oracle upgrade, which I understand is now complete. So we will reassess that risk towards the end of next month and report back accordingly. Some of the additional activities that we've then undertaken, just for you to know, we've been talking about the S1 and S2 ledger movements from Velindre. We've now finalised those and now had those numbers validated. So the property assets and property or asset base has been transferred at 27.9 million, and our working capital is 9.8 million. So that's an important step forward to us in terms of our financial fundamentals. We're also leading the way in terms of the Microsoft renegotiation. So together with Carwyn, with the support of Carwyn and the team, we are leading a national team supported by a national licensing group to evaluate what's required and then start the commercial negotiations with Microsoft. Also to note is the approvals, additional approvals we've had from DPIF, which are significant in the periods, including the Office 365 Centre of Excellence, the Emergency Department additional funding, and the enhancement to the WPAS support, and the digital solution that we've been designing and working on alongside Powys. That totals 5.7 million over the next 3 years. So again, it shows that development pipeline is increasing, and a lot of that investment will follow through DHCW supported initiatives. Also, as part of the FTU and Welsh Government review, we've done a first assessment of our underlying financial position for the next financial year. I've identified and highlighted just shy of 5 million cost pressures and initiatives that we would seek additional funding for on behalf of DHCW. This actually reflects a lot of the conversations we've just been having. There is a 1.1 million underlying ICT pressure that we've been talking to, really reflecting the growth in demand in data and services that we are now being asked to sustain. There is the non-recurrent savings. So I mentioned we will achieve the 1.8 million savings. Only 800,000 of that is recurrent, so we will carry forward £1 million worth of savings requirement. Equally, our cloud adoption requirement, and there's some debate about whether this is transformational DPIF funding or whether this is underlying revenue funding of an estimated 2.4 million is required. And finally, as part of the formation of the SHA organisation, we identified that we planned a number of functions, but we identified that there may be others that we would need to invest in. And we've identified potentially £400,000 of additional SHA functional costs that we might require. Obviously, this is an initial view, but we thought it was important as part of that half-year review to share with Welsh Government our initial assessment in terms of some of the cost pressures that we would entail. And like other health boards and trusts at the moment, they're going through a similar process. So that's really an assessment of the financial position as of October and some of the additional actions and activities that we're doing. I'm happy now to take any questions.
You're on mute, Simon.
There we are twice. Things may have changed, but it was always the case that Welsh Government were particularly loath to underpin cost improvement savings which were non-recurrent, i.e. their view is that they should be recurrent savings. It's for you to sort out. And given that's quite a chunk of that 4.9, what's your feeling, your assessment on?
We had Welsh Government shared with us, because they've now been given it the 3-year allocation from central office in terms of their funding requirement. I think our view echoes Health Boards and Trust views. Is during the pandemic and as part of the recovery, we found it almost impossible in some cases. I think DHCW is one of the exceptions in actually delivering savings during the pandemic, in being able to achieve a savings target. There was a lot of debate about recovery and reset, and the ability of health boards to undertake both health savings and at the same time drive a recovery programme. So I think at the moment Welsh Government is reflecting on what will be our ongoing COVID requirements and activities, and the likelihood of us to be able to deliver both recovery, COVID and savings at the same time. So I think there's still an impression I think there's still a level of debate in terms of how they will allocate the budgets next year and what that will mean to underlying savings, but also underlying deficits for health boards and trusts going forward. So I think that from a DHCW perspective, we have a non-pay and capital group that focuses on areas of improvement and cost efficiency, and we will also be looking at ensuring that we are spending in the most efficient way. But I think we'll find as our recruitment and our vacancies fall, the ability to absorb that will be challenging.
Yeah. Any comments, questions on the Claire's report? So I suppose summed up as things are looking good now, but they're not overwhelmingly massive, but they are significant challenges in next year's budget that you're working to work through. Okay, thank you very much, Claire. If we move on, then it's back to Chris then to just take us through the policy update.
Yeah, so board members will recall on the 1st of April when we established, we approved circa 80 policies to help us operate as an organisation. Those policies were identified as by Welsh Government as essential policies for us as an organisation. And there were a number of policies that weren't in place from the 1st of April. So the report today is just updating board members on where we've got to in developing those policies that weren't ready on the 1st of April. So the communications and media management policy is being drafted now and expected for approval in January 2022. So the communications and engagement strategy. So this is a communications strategy, really. The stakeholder engagement strategy was approved at the September board meeting. So this follows that and works progressing on that, working towards March 22. The anti-malware policy was approved subject to some changes made following the Digital Government and Safety Committee in November. I think the committee members agreed that could be done within 2 weeks of that committee meeting, so we're coming up for that timeframe now. The Welsh language scheme has been drafted. It's had comments back from the Welsh Language Commissioner's Office and is due to go back to the Welsh Language Commissioner's Office for further comment. So we're aiming for a March 22 approval date, but clearly that will depend on how quickly we get feedback from the Commissioner's Office in addressing those issues they might raise, and that's subject to 12-week public consultation, that scheme. The capital management procedure was approved at the October Audit and Assurance Committee. The research and innovation, which was previously down as research and development strategy, is due to come to board in March 22, and I know Rachel's got a trajectory working through that strategy. Security and counter-terrorism policy was approved by Management Board in December, and the relocation expenses policy has been approved and adopted from that from Velindra. So the update is here for board members to note where we've got to in terms of progressing those policies. On mute, Simon.
We don't need to do anything other than notes, do we, on these policies, Chris? Okay. No. Any questions, comments? No. Thank you very much. if we move on to the Audit and Assurance Committee report, and that'll be from you, Marion, I assume.
Diolch yn fawr Cadeirydd. Am mae'n bleser gen I gyflwyno'n adroddiad I o gyfarfod diwetha y Pwyllgor Archwilio Sicrwydd a Gynhaliwyd Dechrau Hydref. Hwn yw'r trydydd cyfarfod ers sefydlu'r bwrdd ac fel y byddech chi'n disgwyl ddaru ni dderbyn cyfres o adroddiadau gan gynnwys rhai gan yr archwilwyr mewnol a chan Archwilio Cymru. I'd just like to draw your attention very briefly, if I may, to some key highlights from our last committee meeting. Pleasing to note that the audit on the transition from NWIS to DHCW received a strong, reasonable assurance rating, and that DHCW had indeed captured learning from that project.
Sorry, Marion, if we just take a pause, because when you switched into English, then it didn't actually, unless anyone else has, it was only me, we didn't get the feed coming back in. So if you just pick up where you switched from Welsh into English, Marion, sorry about that.
Indeed.
That's great now.
I just wanted to draw your attention then to some key highlights from our committee. Very pleasing to note that the audit on the transition from NWIS to DHCW received a strong, reasonable assurance rating, and that DHCW had indeed captured learning from that project going forward. On the data analytics audit, it was reported that good progress is being made on areas such as performance management and KPIs. The committee approved a number of new procedures and policies, namely the capital management procedure, the IT asset management policy, and the commercial services, free goods and services protocol, which involve a suite of protocols applicable to NHS organisations. We got an update as well from Audit Wales on the baseline governance review work, which, as you'll recall, is designed to provide assurance to the Auditor General that the HCW has proper governance arrangements in place, and we expect the outcome of that review to be reported to committee early in the new year. And I'm just going to switch back to Welsh, if I may, for a couple of minutes. Felly, hoffwn ni droi i'r Gymraeg a tynnu'ch sylw chi at faterion ddaeth gerbron y Pwyllgor yn ymwneud â'r iaith Gymraeg. Fe gafon ni adroddiad I ddechrau gan yr archwilwyr ar safonau'r iaith Gymraeg neu ar weithredu safonau'r iaith Gymraeg ar draws y byrddau iechyd. Pwrpas hwn wrth gwrs oedd I ni glywed am yr arfer da a'r gwersi sy'n na i'w ddysgu, sydd yn gyd-destun defnyddiol a phwysig I ni fel sefydliad yn symud ymlaen. Fel y clywsoch chi gan Chris, wrth gwrs, gyda ni ddiweddariad ar ble yda ni o ran mabwysiadu yn cynllun iaith ni. Ac oedd hi'n dda clywed hefyd bod penodiad ar y gweill i'r swydd rheolwr gwasanaethau Cymraeg. Mae hwn wrth gwrs yn swydd allweddol, nid yn unig I helpu ni fel bwrdd I hyrwyddo'r defnydd o'r iaith o fewn y sefydliad, ond hefyd I sicrhau bod y Gymraeg yn cael ei ystyried fel egwyddor wrth I ni ddatblygu yn prosesau a'n systemau digidol ar gyfer y gwasanaethau iechyd a gofal. Ac ar ddiwedd wrth I ni droi'n golygon tuag at ddiwedd y flwyddyn ariannol ymhen 3 mis, 4 mis, mi byddwn ni yn edrych ar y holl themau sy'n na sydd wedi ymlygu hyn yn ystod y flwyddyn, fel bod ni yn llawn ac yn llwyr werthfawrogi ac yn dysgu o'r gwersi a'r themau hynny. Diolch yn fawr I chi.
Thank you, Marion. You've come off mute, Sean. Does that mean you want to come in? No, it doesn't. Okay. Anyone want to comment or ask any questions? If not, we'll move on. I'll thank you very much for that report, Marion, and move on to, oh, Sian's probably unmuting herself in readiness for the next item, which I should be doing, of course. Sian, if you'd like to present what you'd like to out of the the committee you chair, the Digital Governance Committee and Safety Committee.
Diolch Simon i'r cadeirydd, a mi o'n i'n paratoi wrth ddod off mute fel bod fi ddim yn anghofio, fel fi'n arfer wneud. Oedd e'n hyfryd i gadeirio'r trydydd cyfarfod gyda'r Pwyllgor Llywodraethu a Gofal Digidol, a mae rhaid i fi gymeradwyo'r tîm ar sut mae'r pwyllgor hyn wedi datblygu dros y 3 cyfarfod i ni wedi gael. Mae rhaid gweud mae'r ansawdd yr adroddiadau a sut mae'r tîm yn dechrau deall pwysigrwydd y cyfarfod wedi dod i'r amlwg a proffesiynoldeb iawn ynglyn â'r sort of beth ni'n yn weld ar adroddiadau i ni yn mynd trwyddyn nhw. Mae wedi hefyd gyda ni amser i ddatblygu, gyda chyfarfod datblygu yn mis Medi a dechrau adroddiad newydd lle oedden ni'n gallu arolygu rhaglen gwaith DHCW a wedyn gallu asesu unrhyw challenge sydd yn dod ymlaen, heb bod hynny gyda resources, neu gyda'r cyllid, neu gyda edrych ar amserlen yr rhaglen a siwr dyn ni'n cyrraedd y dyddiadau. Dwi nawr yn mynd i droi nôl i'r Saesneg, jyst i roi cynnwys mawr yr cyfarfod. I'll now turn into Welsh, just to go through, we went through the forward work plan, as I talked about, and we also took advice from the consent agenda, and all of those are in the report. As mentioned by Chris, we also reviewed and approved the anti-malware policy with some changes that were asked for from the committee, and these were given a deadline to bring those to the fore to amend that policy. I think we had a very, very good deep dive into the information services and information governance areas of risk, which was a big improvement over the last couple of committees. And we took an action for the chair to write to the Welsh Government regarding some of the risk that we saw in the information governance, to get some direction from Welsh Government, to give us some sound legal basis for collection processing of resident data. And this letter will be set out and keep us updated on the timeframes within that risk area. A big theme that came from the corporate risk register was resources, which we've already talked about, and we commended that the IMTP had real sort of focus on this as we look at the plan for next year. And the last action that came out of the risk register that we look to at the next meeting, look at the long-standing actions on the corporate risk register that had been there for a while, just to understand how we're going to mitigate these and get some action so that we can move them off the risk agenda, or at least give an update on when we can get to see that. So I thought that was a really a good agenda item for the next committee. We approved the terms of reference for the incident review and the organisational learning report, which we think will be a really core part of the committee going forward. And we also had a real session on the programme overview, which I talked about at the beginning. From the development meeting that we had a good session on all of the programmes that were coming, just to give us assurance and understanding of where the risks might be, and some forward thinking. And we also saw some good work that had come out of some of those programmes. So not only looking at risk, but also looking at some really constructive and positive programmes that had been delivered by DHCW, which we've talked about earlier. We had a session on the NDR, and that were ongoing discussions coming from that. So thank you, Rebecca, for that. And then as we talked about the private session, we looked at some of the cyber issues and reviewed some of the reports and the actual corporate risk register as pertained to the private element of the committee. And really from there, I'd like to say y diolch yn fawr i'r tîm, diolch o galon am amser da, a mae'r cyfarfod wedi datblygu a wedi gwella bob tro dyn ni wedi cyfarfod. So diolch o galon i dîmau Michelle, Rhydian a Carwyn am ei gwaith, a please na wneith y bwrdd basio'r hyn ymlaen i'r tîmau, achos maen nhw wedi gweithio'n galed iawn ar yr adroddiadau. And thank you for me.
Thank you very much for that, Sian. And I met with the head of our internal audit last week, James Quance, and he said very positive things about both committees, and that's going to be in no small part the way in which you, Sian, and you, Marion, have shaped the work of that committee, and it's very important for Helen and myself because these are the two assurance committees that probably keep us out of jail at the end of the day. So thank you very much for those reports and the work, and as I say, very positive words about how they're operating from internal audit. Has anyone got any comments or questions on Sian's report before I move on to ask Andrew for your moment in the sun on just anything you want to highlight? Oh no, sorry, my rats, bringing you in too early. The Remuneration and Terms of Service Committee. I'll be very brief. You've got it in the papers. Just draw your attention to one thing that needs to be ratified by the board, which was that the Remuneration and Terms of Service Committee accepted a recommendation from the Chief Executive around identifying and appointing a Deputy Chief Executive Officer, which is Claire, and I do need the ratification of the board for that. It is something that is essential that we have in place, and important that we have in place. Are people happy to do that? Thank you very much. Sorry, apologies for sort of catching you on the hop there, Andrew. So if we move on then to the Local Partnership Forum report, if there's anything you'd particularly like to draw to our attention in that.
Thank you, Chair. Yeah, so just to remind everybody really that I'm co-chair with our Chief Executive, Helen. And it's actually my first time speaking on behalf of the new Local Partnership Forum. There's a bit of a history of having a Local Partnership Forum in our predecessor organisation. This is the first time that we've become an advisory group to the board. But the work that we did prior to Digital Health and Care Wales has really made life so much easier because we already had an established forum. So I'm really looking forward to what we can achieve together in that forum and as an organisation as a whole through that group. It's just to note that the reports in the papers, it was a very full agenda, so I'm going to try and be as concise as possible. But happy to take questions at the end. And of course, if anybody on the board or wider wants to have a chat with me outside of this meeting as to our work, then I'm more than happy to meet up with anybody. Just some brief highlights. I'm going to be leaping around the paper a little bit, so do bear with me. I've sort of probably pick out some of the more workforce related items first. We noted the workforce performance report. I think we're very happy with the content and the way things are going in terms of people's attainment and doing the statutory and mandatory training and what have you. It was highlighted that it's so very important that robust information is recorded in the electronic staff record. We also said that we'd like to see more of a push to improve the uptake of staff appraisals. It's they are. It's not a serious problem, but we want to improve on what the numbers of staff who have done their appraisals to closer to the 100% mark as we can, really, to make sure that staff are developing properly, of course. We discussed job evaluation training. We're looking as an organisation to have our own job evaluation panel, and this will take some of the reliance off health boards and trusts to provide this function on our behalf. So we're looking at staff sides reps for that. We were, as you probably appreciate, we're actually really keen on knowing the views of our staff, and therefore it was a great pleasure to receive an update on the recent staff survey, and we were very pleased to note that staff perceived their well-being as having improved due to more flexibility to work from home. I think there was a little bit of a concern as to how some staff would you know, that there might be issues with some staff working from home, especially people living on their own and what have you. But it's just for members to note that we are keeping an eye on this, and the organisation are keeping an eye on this. So we haven't forgotten those people that find it difficult to work outside of the usual office environment. The other thing from a workforce perspective was the annual leave buyback proposal. We've supported the proposal. We recognise completely the effort that staff have put into the organisation and haven't had a chance to take leave. We have closely scrutinised it from all sides of the table to make sure that staff weren't actually going to burn out, that staff did take leave when they could. And it was really, really helpful to discuss all these different points before it went to the remuneration and terms of service committee. We were satisfied that the necessary safeguards were implemented in terms of ensuring a certain amount of leave was taken beforehand. But it's something that we need to just keep an eye on as staff work at the moment while things are so busy, especially in supporting some of the additional services that have been created as a result of the COVID pandemic. And just to skip really through the next few items, there's no surprises that, really on a lot of these. A lot of them have been on today's board agenda. We had a discussion on risk management, particularly around the workforce areas of risk management, staff vacancies, and the impact of COVID on resources. We've had updates on some of the relevant strategies, such as stakeholder engagement, people and professional organisation development strategy, our cloud strategy, also two other work areas that are going to be developing, such as e-prescribing, and of course we've looked at the policies. One final note, we will always look at things like organisational change, and we've been very pleased to have updates on the appointment of the new executive directors and the finance structure update, and just to commend those involved in those organisational changes as to the engagement that they've had right through the process, really. So other than that, I think I can just extend my thanks to members of the Local Partnership Forum and of course the corporate governance team for helping us to facilitate the event, and we look forward to many exciting local partnership forums to come with very full agendas, I can imagine.
Thank you, Andrew, and it's certainly my intention, if invited, to pop along to one of your meetings in the not too distant future, that we perhaps could discuss that between us and around when and how.
Definitely.
Has anyone got any comments or questions on that? If not, I'm going to, Michelle, we do need to formally approve the strategic procurement plan. It's in the papers. I'm sure there's nothing you want to add to the paper. Everyone happy to approve that? Thank you. I've had no other urgent business brought to my attention. Just be aware that if anyone has, they're keeping people from their lunch, which is never a sensible thing to do. Okay, thank you very much. The date of the next meeting is in the 27th of January. I will now bring the meeting to close with a final thanks to Sian for all of her contribution as an independent member of DHCW, and wish her very best for the future. And as they say, I think, don't be a stranger. We will all reconvene for the private part of this meeting at 2 o'clock. So hopefully that's enough time to refresh and recharge the batteries. Thank you all for attending this morning. I will see you in 20 minutes or so.